these fuel cards are for us. Credit cards for fuel.
I don't know what that is. No.
I'd like to call the February 2021 meeting to order. First thing on the agenda is suspension of the rules. I need a motion to suspend the rules of procedure to allow the attendance of legislators telephonically and to add a resolution to the agenda. May I have a second, Mr. Lightfoot? Any discussion? All in favor?
Aye.
Carried. Could we have roll call? Go.
Reagan. Forsythe.
Here.
Lightfoot.
Here.
Smithers.
Here.
Denisha.
Here.
Perkins.
Here.
Akers.
Here.
Kay.
Here.
Haggard.
Here.
Piazza.
Here.
Burke.
Here.
Marquette.
Here.
Terminelli.
Here.
Curran.
Here.
15 present.
This time I'd call on Legislator Larry Denisha to give a prayer and followed by the Pledge of Allegiance.
Bow our heads, please. Dear Father in heaven, we're grateful for the opportunity to gather here this evening. God, please be with us as we weigh the pros and cons of our constituents' requests. Give us individually and as a body the wisdom to best represent everyone. Father, we also ask that you grant us the courage to work with one another so that we may achieve solutions that are best and just for all, and that we may continue to boldly represent our constituents' needs and those of the most vulnerable among us. Grant us the strength to be thankful for the blessings you have bestowed upon us, and allow us to cast aside all envious thoughts and wishes. For all these things, we ask your blessing through your Son, our Lord Jesus Christ, through whom all things are possible. Amen.
Amen.
I pledge allegiance to the flag
of the United States of the Republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, I need a motion to suspend the rules of procedure to allow the attendance of legislators telephonically and to add a resolution to the agenda. Well, wait a minute, I'm already done that, excuse me. Need a motion to amend the agenda to add a resolution to be presented under suspension of the rules as number 16 to presentation of resolutions. May I have a second? Second, any discussion? All in favor?
Aye.
Opposed? Carried. Another resolution, approval of the minutes for January 4th, 2021. Do I have a motion, Mr. Larry Denisha, seconded by Mr. Harry Smithers. Any discussion? All in favor?
Aye.
Opposed? Carried. Next, we have a presentation that will be coming in by way of Zoom from our North Country Congresswoman Elise Stefanik. Is the Congresswoman on?
I am. Thank you, Chairman Sheridan.
Very, very welcome. Pleasure to have you with us, Congresswoman.
Great. Well, thank you so much for the opportunity to connect with all of our county legislators in St. Lawrence County, all of the constituents who are viewing on YouTube. I wanted to provide a brief update. I'm doing this to each of the 12 counties in the district as we get started on another year of important congressional work serving the North Country. So first, I thought I would outline the COVID package that passed at the very end of last year in December. This was after months and months of negotiations and effort, but there were some very critical results, particularly funding that is going to help support these small businesses as well as communities in the North Country. So first, that COVID package included $325 billion of additional funds Paycheck Protection Program. To date, in the North Country, there's been $250 million directly invested into small businesses through the Paycheck Protection Program. As small businesses reach out to you, it's important to let them know that many are eligible for a second draw of the Paycheck Protection Program. Eligibility is determined by if you've used the entirety of your first PPP tranche last year, and if you can demonstrate a 30% decrease in revenue in Q1, Q2, Q3 of 2020 when compared to, so this is very targeted towards small businesses and industries that felt a significant hurt last year as we worked through the pandemic. Additionally, the Paycheck Protection Program deductibility issue. I know many of you are small business owners yourselves. This was a top concern that we heard from so many businesses, manufacturers across the district who initially applied for the PPP with the assumption that they would still be able to deduct their expense, payroll, their utilities. Unfortunately, initially the Department of Treasury misinterpreted that and did not follow congressional intent. And there was some confusion at the end of last year whether they would be able to deduct. I was able to work directly with the Secretary of Treasury to ensure that businesses are able to deduct those expenses. So as you get questions from small businesses, there are some brief updates. Of course, my office is always there to provide additional support and answer questions. In addition, our schools. As I've worked with school superintendents and BOCES across the district, it's incredibly important that they receive direct federal funds as soon as possible. In the package that passed in December, there's $5 billion allocated just for New York State school districts. That by law has to be sent directly from the state to the school district in this year, 2021. So we will be urging the state to release those funds as quickly as possible to our school districts who have done, they've worked so hard to make sure that they're serving our students during this challenging time. Our higher ed institutions, obviously an important part of the St. Lawrence County economy. I just wanted to highlight the federal resources that have gone to the colleges. Clarkson has received $6.4 million. St. Lawrence University has received $4.4 million. SUNY Potsdam, a total of $11.6 million, and SUNY Canton, $7.4 million. Additionally, the hospitals. This is an area where my office really focused on. The hospital relief to date in the North Country is $140 million direct federal funds to hospitals. That includes all of the hospitals in St. Lawrence County. Another issue that I know that you're all very aware of and hear from constituents on is the border reopening process. At the end of the Trump administration and the beginning of the Biden administration, I've worked as co-chair of the Northern Border Caucus to really urge an increase in these bilateral conversations to make sure that we can bring greater certainty and avoid these 30-day arbitrary extensions. I recently put out a public statement with my colleague from Buffalo, Brian Higgins. It's bipartisan. And the way we want to address the border reopening is provide certainty as quickly as possible with prioritization for property owners, for family members on either side of the border to ensure we can reunify families, as well as prioritizing vaccination distribution to our CBP officers to ensure that we have that safe ability to cross the border, as well as reciprocity, particularly in our boundary waters. That has been an issue along the St. Lawrence River with some of our tour boat companies and our boaters in general. So we want to address that as quickly as possible before we get into the high season. Another issue that I wanted to update you with is on the vaccine funding and the vaccine distribution. This continues to be a top concern that we hear from constituents, and you're hearing as To date, the federal government has allocated and provided 2.93 million doses to New York State. Unfortunately, New York has only distributed 1.87 million. So there's a delta there. We need to continue to work with the state government and our state electeds to improve our vaccination distribution. I do want to take this opportunity to thank our county public health officials and our hospital officials locally in St. Lawrence County. They've been doing a great job serving the community and really working under challenging circumstances. Lastly, Bill, you asked for an update on the COVID package introduced or laid out by the Biden administration. That is just an outline at this point. It's a $1 package. This would be the fifth COVID package that we pass. And while there are provisions such as state and local support that I would support, there are very concerning partisan provisions such as increasing the minimum wage to $15, stimulus payments for illegal immigrants, release of criminals that I don't support, and we need to work through to really have a bipartisan targeted package going to families, businesses, hospitals, and municipalities that need it. So thank you for the opportunity. I will turn it back over to you, Chairman, and happy to answer any questions. Bill, I can't hear you.
There's no questions for you, Elise.
Okay.
I don't see any hands, so thank you. It was very informative, and I'm glad that you touched base with it. I understand you've done the same sort of thing, Washington County and Warren County. And so thank you for being here and letting us know what your initiatives are here in St. Lawrence County.
Great. Thank you so much, Chairman, and please be in touch. We will continue serving all of our constituents and working our very hardest. I know you have a lot on your plate, so thank you for the opportunity. Have a good night.
Thank you. Okay, the next on the agenda is the COVID-19 update with Dr. McGuire and Dr. Williams. Which one would like to go first this evening? Probably, let me guess, Dr. McGuire. Dana, did you want to go first?
Yes, I will. I will just share my screen. Good evening, everyone.
Good evening.
Okay, can you see my slides and hear me okay?
Yes, I can see your slide, Dana.
Okay, thank you. So I'm just going to give an update first on COVID-19 cases for St. Lawrence County. To date, we've had 4,064 cases. We currently have 32 people in the hospital. There are 922 active cases. That includes those in isolation and those in the hospital. 3,875 have been through the isolation process, and we have now had 6 deaths since the response has started. Here is the curve that I show all of the daily cases since March 25th. There have been 455 cases since our since the last meeting last week, and we have had 3 deaths in this most recent week. Here is a graph of the cases we see on a weekly basis. I did not put in data from the past week as we still have one more day. But you can see that for the past 4 weeks, there's been a great increase in what we've seen on a weekly basis. So we're just under 600 cases per week for these 4 weeks that you see here. When you look at the cases on an average daily rate, you can see that during the holidays, so it's the 2 weeks really that followed the Christmas and the New Year holiday, You can see that we're at an average of just over 80 cases for these 4 weeks. For the entire month of January, there's been a daily average of about like 78 cases per day. When we look at how many people have been through the isolation and quarantine process, like I mentioned, we have 922 people who are either in the hospital or in isolation. We have 1,500 people in active mandatory, so those are the people who have been exposed to someone who has tested positive. And we have over 18,000 people who have been either through the isolation or the quarantine process since the start. Last week, I gave an update of what we were doing in the department to really look at case investigation and contact tracing. As with the holiday season, we had seen that stark increase in the amount of cases and therefore the amount of contacts. And for a while, it was taking us quite a few days to get to folks. So I talked about what we did to try to increase what we have on the case investigation side and on the contact tracing side. And this past week, that virtual team we have doing case investigation is now doing just over like 100 cases per day. We still have 2 school specialists and we have someone on site, and these are all through the support of the New York State Department of Health. For contact tracers, we again are using that virtual team, and there are some cases that we do need to take back. So workplace exposures, those who are asymptomatic, and then when we don't have that contact information for them. So it's really important to know that it's probably not going to be a person who is local that will make the phone call just to you for that case investigation or to do the contact tracing. So please just answer your phone and so we can get that started. But we are making contact with cases and with contacts, I would say most times just within like a 48-hour time period. One other thing that I wanted to remind people of is that the order that you receive for isolation and for quarantine can work as the release letter. So we do get a lot of calls and emails that they need just a letter to go back to work. But the order that you did get from this office will work as it has the dates that you started and then the dates that you did do the ending of the isolation or the quarantine. To talk a little bit about vaccine, so I mentioned last week we are part of a hub. We continue to meet with the hub, which includes all of the counties in the North Country region. We do have phone calls with them 3 times a week, and we also provide data to the hub twice a week. And so in a few slides, I'll show you what we have just going on with that. For the community pods that we have, we've been talking about the SUNY Potsdam site, and we have had now 2 weeks worth of pods. So the first week we did just over 200, and this past week we did just a few more. And that's because at times we can draw a little bit more vaccine from each of the vials that we work with. The first week we did a pod at the county jail, and then this last week we were at St. Lawrence, the university, and that was really a great setup. So we have more space as we start thinking about how we're going to do this when we have to do the second doses as well. We did find out over the weekend that we will be allocated more than 200. It's due to the increase that the federal government did give. And so we had a phone call this weekend to talk about what that kind of extra allocation would be used for. And so we have 200 to use for the 1B population, which still includes law enforcement, teachers, EMS, fire workers, courts, grocery store workers. So there's really no change in that population. The change that we have is we have 100 doses for the 65 and the older group, and 100 doses for the OPWDD group, which is those who live and work in a group home. So we are working with those new populations, just to see how we can get a vaccine out to everybody. Just a reminder that each of the provider groups does have a priority that they have to work towards. And so hospitals are still functioning to provide vaccinations to healthcare providers. Pharmacies are working hard to do the 65 and up group. And when I looked at the data that we're able to pull, so the local health department can pull data for the county, and it looks like pharmacies have done over 1,000 vaccines for nursing homes. That includes the residents and the staff. And then at the pharmacy stores themselves, which would be the 65 and up group, they have done over 1,800, and that is up through the 29th of this past month. We, again, like I said, are doing the 1B population, and then the state sites can do both. So here is some of the data from the hub, and you can see that by county what we've been doing. And so St. Lawrence County, I think this goes through the 27th of last month, has done over 13,000 vaccinations. And when you see this dashboard, you can also do a filter by the county. So there at the bottom, I do show just how many people have received a first dose and then how many have received both. By the provider types, you can see what hospitals, what the pharmacies, what local health departments, and then what the 2 state sites have done for the North Country region. And then by age group, you can see that what has been done for all of them, and you can see that the aged population has been served well for the North Country region. That red line is for the population in each of those groups, and then the blue box is for what is actually done. Lastly tonight, I did want to talk about the high-risk sports guidance that did come out on the 22nd. So we did hear from the state that there was new guidance. So we have had several conference calls with the state and with all of the counties just in New York State to talk about, what this means and, what we're supposed to help all of the agencies and schools do with regards to now the high-risk sports that have been added. And the 3 things that we were really tasked to really look at is kind of whether we were seeing more of the variants here just in the county, the local rates of the transmission, so what we're seeing here in St. Lawrence County, and then the ability to monitor and make sure that those who choose to, take on the higher risk sports can do so just in a safe manner. So there have been just a number of studies that really look at what sports and the transmission of the virus, can do. So I wanted to highlight 2 of the studies. The first one was done on just a hockey team, and 5 days after a game that was participated in, there were 15 out of the 22 players that did experience symptoms. 14 people were players, and 1 was a rink staff member. 10 of the players were on one team, and then 4 of the other players were on the other team. It was interesting to note that the team with the index case, so the case that started as a positive, did have more cases, which could be due to sharing locker rooms and more time close together on the bench. There were 13 positive tests out of the 15 who had symptoms, so they did consider 2 to be cases based on those symptoms. And some of the limitations in this study were that not all of the individuals were tested. So kind of the summary of this study is that the ice rink is an environment well suited for the transmission of COVID-19 due to the exertion, to the breathing, and oftentimes the players are just closer than 6 feet. The next study I just wanted to talk about just kind of came out in the last few days. There wasn't a nice graphic that really showed what kind of went on, so I thought I would kind of walk through what they looked at. This was a 2-day wrestling tournament, and there were 10 participating high schools. Of those schools, there was 130 people who were in attendance, which included just the wrestlers, the coaches, and the refs. And 13 of the wrestlers were tested from one school, and that's how they first found that there was positives just 4 to 5 days after. So there were 13 from that one school that did do the participation that did test positive. There were 40 people more that were attested from 9 out of the 10 schools, and so altogether there were 54 tests done. And so there were 38 cases identified out of the 130 people who went to the tournament. From those 38 cases, there were over 400 contacts that were identified. 62 of those contacts were household members. Just under 400 were school contacts, so that could have been students, teachers, it could have been other kind of members on that hockey team. 95 of those contacts were tested, and there were 41 positive tests from that, and about half of those just had the symptoms. The positivity rate was highest in household contacts, and next it was those who were on the team. There was 1 death reported, and from all of the positive cases and all of the contacts, due to the 2-day tournament, there were about 1,700 school days lost due to the isolation and the quarantine process that did go on. As a result, from this outbreak, it led to a suspension of the winter sports for this year for that school, and that was the school that first found that they had the 13 wrestlers that did test positive. So there have been a few things that have shown that there's been just a relationship between sports and the transmission of the virus. Here in St. Lawrence County, you can see since school started just how many cases we have on a weekly basis. Now, we really haven't seen transmission in the schools, but due to the high infection rate we see here in the county, there have been a lot of cases in staff and in students, and so that has led to lots of isolation and quarantine, and sometimes led to just the remote learning environment. So you can see here in the January time, we've had the highest school cases, with some weeks just around like 80 cases. It does seem that, as we look at the epi curve that I did show at the beginning, that it's possible we can start to see a trending down of the cases. But you can see that the daily hospitalizations is really still quite high in this current last month. You can see in the November time, the average daily hospitalization was just over 10. And for the month of December, it was about 17. For the last month, it was about 30, and it brought it down to 30 because the first half of the month, you can see that the hospitalizations were just lower. So we still are experiencing quite a bit of hospitalizations just due to the cases that we see. And I just want to note that there are a few days that we don't have hospitalizations, and that was due to a weekend or to a holiday. So with that said, and the sports guidance coming out, we put out guidance for, that it is still high risk to participate in these sports. But if you're going to do so, we put together a few things to try to make it just as safe as possible. So as an outline of what we put together is that first, you should create a safety plan. And that's been the same guidance it's been for all of the sectors that we have. So you can find that on the New York Forward website. That there should be a consent form. You should consider the transportation to and from games and that carpooling is not recommended. There are certain travel guidelines staying in the North Country region and then like the regions around us. It's important to take attendance so you know who are events and these sports, and then be able to participate in the tracking should there be just a positive case. Really looking at spectators, and we recommend just one spectator for high-risk sports. To wear face masks at all times when playing sports. It is recommended that athletes, coaches, and those involved in the sports should be tested on a regular basis. There is guidance for social distancing and flow to make sure that you're watching the traffic flow and making it just a one-way. There is specific guidance on hygiene and the cleaning and not sharing of the sports equipment. And then to really actively participate in case investigation and contact tracing, should that be necessary. So we did put that out this weekend, and so we've been answering lots of questions to teams who are just looking to put their plans in place. And so as we move into vaccine and more people get the vaccine, it's still really important to keep in mind all of the things that we've been talking about. So mask wearing, social distancing, washing your hands, and being aware of how you feel is just important. So, even though you're going to get vaccinated, all of these things are important. And if you are exposed, you'll still go through the quarantine process as the guidance from the state yet has not changed. And at this time, that is what I have for my presentation. I will stop sharing and let Mr. Blue continue. Thanks very much.
Any questions of Dr. McGuire? Nicole, go ahead.
Thank you, Mr. Chairman. Dana, thank you for the update and thank you for the clarification. I know I've received many questions in the past few days from constituents about sports and public health's role in the ability for school districts and Section 10 in the BOCES region to participate in sports. So I'm glad to see the update and the safety parameters that have been put into place to ensure the safety of coaches and athletes should districts prepare to go forward. I just have a couple of questions. The first one, the example that you showed about the hockey team. Now, I would imagine that was one specific example, correct, from one particular school. So do we know any of the safety precautions that were followed or were any followed? And the reason I'm thinking this is I'm just thinking, were they wearing masks? You mentioned something about locker rooms. So did they have precautions in place that there were no shared locker rooms and that parents were transporting their own athletes and that they had cohorted maybe practice times? Or is this maybe a school that didn't have those safety precautions in place?
So the study did not talk about all of those precautions. What they did mention is both teams had separate locker rooms, so they did not use the same locker rooms, but it did not talk about masking. It did not talk about the transportation to and from the game.
So in all actuality, it could have been in an area that doesn't use safety precautions at all, really. I mean, I know I have friends in Florida that said that they don't wear masks anywhere. So it could have been from an area like that, correct?
Yeah.
Okay. And one other question, may I ask another question? Mr. Chairman?
Yes, go
Thank
ahead.
Thank you. So if school districts decided to move forward, maybe even in a phased approach where they didn't bring back all sports at once, but even if they chose some that were maybe a little bit less risk, or that they could put safety precautions in place that they could guarantee, what would public health's role be in helping them design these plans? Would there be that support, or would it kind of be each district on their own?
So just like I mentioned, each sector, as we've reopened, does have to do a plan. And so if they had any questions on what should be on their plan, but the template is there from the state. So you have to look at like people, places, and all of the processes. So we are here to help them on that and to help them through that process. I've been answering questions from some of the other agencies, and so we just want to make sure that there's a sound plan in place and that we can have it on file, that the teams keep it on file, so that if there are questions in what is being followed, we can go back to that, or they can go back to that as well.
Okay, great, thank you. And just one last, can you clarify, if we've had several schools here that have had to go remote, whether it's a middle school or a high school or an elementary school, kind of in and out, back and forth with remote and then back in person, if what would the Department of Health's recommendations be about a school district that's gone remote? Would they still be able to participate in sports and practices, or is that are they not allowed to participate while the school is remote, or while the student is remote?
Yes, so while a student is remote due to isolation or quarantine, they are not able to participate. And the same would go for the school district. If the school district has decided to go remote because of a case or an exposure, they cannot participate as well.
Thank you. Those were just some of the questions that I've gotten over the past couple of days that I just didn't have the answers for. So thank you.
Sure. Yeah.
Any more questions for Dr. McGuire?
Yes.
Mr. Burke, go ahead.
Dr. McGuire, are there any metrics that you have in place that would serve as a safety switch? I'm under the belief that other counties, other public health departments have used positivity rates and the availability of hospital beds as measures for when it would no longer be safe to engage in the sports. Do we have that here in St. Lawrence County? And I have a couple of other questions after this too.
Yes. So we do not have a metric for a positivity rate. I believe some counties are using the 4%. As far as hospital capacity, I am not aware where we are. I know that cases have, increased, and I believe Dr. Williams is going to talk about that in his portion.
Okay, and if I could ask, the weekly testing, the recommendations for weekly testing, who bears the cost of that, and is it the schools that have to facilitate that? The reason I'm asking, I'm wondering if the plan that the county has laid out is doable. And if it's doable, how many of the recommendations would they have to follow to be safe? And again, I wonder about the weekly testing. I've heard that all the school budgets are strained like many other entities, and I just wonder about the cost for that.
So the testing is a recommendation. It's not a mandate. And the testing would fall on the agency itself, or the families, or the school.
Mm-hmm. Just one last question. All of the, I'm as I look down through here, there's a number of recommendations, and I'm wondering any school district would not want to follow the majority of the recommendation since it correlates with student safety. And is it feasible? Can they do that? Do we know how they're reacting to this? Again, I guess I'm wondering, we can put out all the guidelines we want, but if it's not doable, then the guidelines aren't very realistic, I guess is what I would say. Again, just your assessment on that.
Yeah, so we met with the schools and discussed current case rates, current cases that involve schools, what they're going on with, case investigation and all of the quarantines, how many schools are currently not on site, due to this. So I believe almost half of the schools at least have one part of their school being just in the remote setting currently due to cases and contacts. And so they want to make sure that before they take winter sports on, they're not opposed to it, and we're trying to help them get a plan put together. They want to make sure that they're ready, because safety is their first priority. And they do. I mean, I think they've been working hard to stay open, so they're trying to balance that as well, and just make sure that they have everything in place before that they do that.
Thank you.
Mr. Light, go ahead, Mr. Akers.
So thank you, Mr. Sheridan. Dana, could you tell us is there an actual morbidity rate across the country for COVID? Do you know what that percentage is?
Is there a what rate? I'm sorry, I didn't hear you.
Excuse me?
Morbidity rate.
The morbidity rate for COVID. Do we have a national morbidity rate?
I'm not sure of a morbidity rate. No, I'm not.
So are you aware of any morbidity rate for high school students or students of this age that would be competing in sports?
I am not, and I'm wondering if you're asking about a morbidity rate or a mortality rate. I'm not sure what you're asking.
Well, mortality.
Okay. I am not aware. I can look into that, but I am not aware. But like the example I showed of the wrestling tournament, it doesn't always take the athlete who was at the tournament. It gets transposed into all of those contacts and them going home. So the point in that study was all of the people who turned to have a positive test result were the household contacts or the school contacts. So, it doesn't necessarily have to be that student athlete that participated in the sport.
Right, well, we know that about 70% of the rate of transfers in the family, that schools are actually relatively safe. Would that be correct?
So far, I am not aware of transmission within the classroom. I know this fall, with regards to fall sports, there was 3 or 4 cases just related to transportation, so the bus ride too, and things like that.
Okay. Are we aware of any trend toward suicide or suicide attempts in St. Lawrence County in this particular age bracket? I know that we have on our mental health list, we have a waiting list now, which we did not have previous to October.
I am not sure of all the age categories of the recent suicides we've had. I'll have to take a look at that.
Okay, so my final question is, your recommendations, they are following what's coming out of Albany, is that correct? They aren't anything in addition or less than?
The recommendations really kind of reiterate what's in the state guidance, and it's through conversations across the state, yes.
Okay, thank you, Dana.
Any further questions for Dana? Okay, thank you very much, Dana. Dr. Williams?
Sure. So I'm going to go ahead and share my screen. Okay, so I'm just briefly going to go over the national trends with COVID, because again, I think that's informative. What you see is, despite a pretty significant peak kind of in the middle of January, we've had some improvement in the number of new cases per day on a national level. If you look at deaths, however, we're still around 3,600 deaths per day. As is the nature of COVID, there tends to be a delay between when people are diagnosed and when they become ill, and an even greater delay in terms of when they die from the illness. So we still do see quite a number of deaths per day. Overall, we have 26.2 million documented cases. We have almost 450,000 deaths and about 95,000 people hospitalized. If you look at this column where it looks at the 14-day change, there is some room for optimism. There's a 32% decrease in the rate of diagnosis. There's a decrease in the daily deaths, and there's a decrease in the number of people who are hospitalized. So again, on a national level, there look like there's some favorable trends. If you look at the North Country region, which is a 7-county region, for new cases, we, as a region, peaked at around 76 per day. And then you're starting to see in the last couple of weeks, again, some room for optimism. I will point out that we are still, a lot of our decisions about different things happened in October when we were down here. We're still on the top of the mountain. We may have gotten to the other side, but we're still at a very high new cases per 100,000 as a region. And as Dana illustrated, certainly in the county. For percent positive tests, we had been around in the high 9 or 10 region. We're now at about 6% as a region. And I wanted to point out that if you look at the different regions within New York State and you compare the 14-day percent positive, the North Country is actually in the top 3. So we're at 6%. And Long Island and Mid-Hudson are at 6.4 and 6.2%. One of the challenges I think we have as a county, sort of both a blessing and a curse, we do a tremendous amount of testing. And because the colleges are frequently testing a generally healthy population, our percent positive gets skewed by that. So when we talk about picking a threshold for sports, the capital region, most of the counties in the capital region picked 4%, which makes some sense epidemiologically. But again, the percent positive is a reflection partly of how well the community is doing with testing numbers. So it's an imperfect measure. If you look at hospitalizations, and the first graph I'm going to show you is for the regional census. So again, back in October and November, we were all the way down here. Still too many people in the hospital from this illness, but not that many in the scheme of things. And really since then, we certainly saw after Thanksgiving and winter holidays into the mid of January, a very substantial upslope in the number of cases. And again, like what you're seeing in the region, you are seeing a little bit of a downturn, but we're still at a very high level relative to where we'd like to be. Now, St. Lawrence County seems to be trending a little bit behind a lot of what we're seeing in the region. And this is St. Lawrence Health System's inpatient COVID unit. So this is where all the people who have COVID get hospitalized. And what you can see, I didn't even bother with the late summer because there were many days where we didn't have a single patient. This top number is around 30. But what you see is a very steady increase, which is ongoing in the number of people who are hospitalized at our largest hospital system in the county because of complications of COVID. There was something published in the CDC on the 26th, which I thought was interesting. This is not local, this is from a rural area in Wisconsin, where they looked at schools. And again, like what Dana presented, the advantage of these CDC case series is there's a lot of information out there in the media. There's a lot of information on social media, but the CDC tends to do a very thorough job of putting the best science behind these studies. So this was an example of a rural community in Wisconsin. And what they found is that for in-person education, they only had 7 out of like 4,800 students who were positive, and 0 of the staff were known to have gotten COVID while they were at school. And I think it's very important, though, to emphasize that in this particular area, they were very strict about using masks. They were very careful about how they grouped students. They maintained 6 feet of distance, and they were apparently very adherent to quarantine after exposure. So with those measures, they did very well. If you look at the data for cases among school-age children or teenagers in our community, what you see is that the rate for people who are actually in school is lower for people than compared to the people who are doing online school only. So again, in a controlled environment like a school, where masking can be nearly 100%, where physical distancing can be enforced, it can be a very safe environment. And I want to make sure that people understand this is in a classroom. I'm not talking about sports per se, but I'm talking about in a classroom environment. So as some schools, try and do more in-person learning, it can be done safely. As far as testing, if you look at our county, again, we do very well with testing. We've tested about 180,000 times with our population just being slightly over 110,000. Our goal, and I've talked about this before, is for most of the testing to be done through PCR because it's much more accurate. But we really want to have that PCR testing done within the county. We don't want to send labs off to reference labs. If people remember, we're having those 7 to 10 day turnaround times. That's very problematic. And again, we want to, de-emphasize the use of antigen tests. These antigen tests, about 20% of the time, you have somebody who has COVID who gets a negative result. It can be very misleading and can cause problems. So we're really trying to do the on-site PCR testing. And thanks in part to the county, both St. Lawrence Health System and Claxon Hepburn now have Rheonics instruments. And I think by the end of even this week, you're going to see 100% of the testing done on these machines at both hospital systems. As far as vaccines, nationally, there have been 31 million vaccines administered, which is not what we'd like it to be. But if you think about that number, that's quite a few vaccines. If you look at what's happening in New York State, this is 250,000. So on a weekly basis, we get about 250,000 vaccines allotted to the state. And that has a lot to do with the prioritized administration that Dana went over. The total doses administered in New York State is about 1.6 million. Again, a lot of vaccine, not as many vaccine as we'd like to see. Now, right now we're using the Pfizer vaccine and we're using the Moderna vaccine. The Johnson & Johnson vaccine seems to be the likely next candidate or third vaccine that's going to be available. And they did just publish preliminary data from their phase 3 trial. Now, again, this is a different kind of vaccine. It actually uses a benign, like a harmless version of a cold virus that then delivers RNA to your cells, which allows your cells to build spike proteins, and then your immune system develops antibodies to those spike proteins. They had approximately 44,000 participants. They had multiple countries involved, including South Africa, which, as I'll get to, is very important. What they found was that it was 72% effective in the US, and it was 66% effective overall in preventing moderate to severe COVID-19. And that was measured 28 days after vaccination. Interestingly, it was less effective against the South African variant, but it was still 57% effective. And in the vaccine world, that's actually not bad. Perhaps more importantly, it was overall 85% effective in preventing severe disease. That was just severe disease. And very positive, it demonstrated complete protection against COVID-19 related hospitalization and death as of day 28. And from my reading of it, that included people in South Africa. The protection, again, was across all geographies. It did include this South African variant. And one of the things that's appealing is that it's a single shot, a single injection, and it doesn't require the same kind of refrigeration as the Pfizer and the Moderna vaccine. I will point out that they're simultaneously doing a trial to look at a 2-injection version of this. So although it will initially probably be approved as a 1-injection vaccine, I have a feeling that their 2-injection version is going to be better, and that they may come out with a recommendation to get a second injection. As far as the variants, there are 3 main variants. This is just a slide that really shows where those variants are. The main variant is the UK variant. And what you can see is that Florida is winning the charge there in that. And somebody alluded to the lack of mask wearing, which may or may not be related. And then California. And then unfortunately, you can see that New York State is a darker shade of greenish blue. This is a table that just talks about the 3 variants that we're currently following. In terms of contagion, they're basically all more contagious, which is the reason for concern. As far as case fatality rate or virulence, it's really not entirely clear. The UK variant, there was some preliminary concern that it was had a higher case fatality rate. So if you were to have this infection, you're more likely to die. For the South African variant and the Brazilian variant, it's not clear at this point. For vaccine efficacy, I would say for the UK variant, it's pretty clearly fully effective, the current Moderna and Pfizer vaccine. For the South African variant, there is some data, and it suggests that it is effective, but slightly less effective. For the Pfizer and the Moderna one, we don't know about the Brazilian variant yet. And then, as I just presented with that map, each of these is present in the US. Right now, the South African variant and the Brazilian variant are just in a few states. But in the US, the UK variant is present. And in New York State, the last number we heard was that there were 42 cases. The way this works, the next number will be much higher when it's announced. In terms of strategies for these variants, and I want to emphasize that right now, nobody thinks that these vaccines need to be changed. But if these variants become more resistant, or if there are other variants, a couple of options. One is that the current vaccines, the Moderna and Pfizer one, could be updated. And yeah, the idea would be you'd get the first 2 vaccines, but then you get a booster, a 3rd shot that was like a booster, and may even be a seasonal thing like the flu shot. And then there are people who are currently developing other kinds of vaccines. There's a lot of talk about the spike protein is the main thing that is utilized, but they can also make vaccines that create non-spike antigens, and that may give a different kind of immune response. So these are just strategies that you may see being put into place if there are new variants that are vaccine resistant. So finally, national epidemiology trends are favorable. There seem to be decreased cases, decreased positivity rate. The death rate is lagging, but that's to be expected. Both regionally and locally, however, we remain categorized as essentially at extremely high risk level. However, in the last week or 2, there are some positive trends. In-person school and activities in which masks, physical distancing occurs are relatively safe. St. Lawrence County remains, as far as testing, we're doing extensive testing and we're becoming more efficient. The vaccine rollout is facing challenges, but there is significant progress. And as Dana showed, St. Lawrence County numbers are actually quite favorable compared to the rest of the region and frankly, the state. And these variants are concerning. Public health measures remain critical, and getting these current vaccines out as fast as possible is very important. And that's my presentation.
Any questions?
Yes.
John Burke.
Dr. Williams, in the guidelines for the high-risk sports, it says the New York on Pause protocol requires all individuals not actively participating in sports to wear acceptable face coverings when in common areas or when unable to physically distance. That unable to physically distance, is that defined anywhere better than this generic term of unable to physically distance? I mean, I know, you know, they've talked about the 6 foot rule, but then you see people on TV who say, well, 6 foot gives some protection, 10 foot gives you more protection, 15 foot gives you even more protection. So I guess I'm wondering, I'm wondering about that particular statement. And if I could ask you in general about face masks, you know, you see people who just have their mouth covered and not their nose covered. I wonder if you could just address that as well.
Sure. I mean, I guess the two things I'd mention. So face mask is almost useless if you don't cover your nose and your mouth. So anyone who thinks that they're helping themselves or helping others by wearing a face mask over their mouth, or I've never seen someone wear it just over their nose, but same difference. So face mask needs to be worn properly for it to be effective. It should also be of the appropriate material. And there was discussion earlier on about what appropriate material is. I think most people in public health just said, listen, as long as someone's wearing a face mask, we're not going to get into the details, but it should ideally be made out of the multi-layers and conform to some basic principles of good construction. As far as physically distancing, I mean, I think one of the challenges that higher risk sports have, and that's why they're considered higher risk, is that for some sports, I mean, you know, full disclosure, I was a varsity wrestler. I've been involved in coaching wrestlers. I have wrestlers in my household. You know, physical distancing is just not part of that sport. The American Academy of Pediatrics also cautioned about trying to wear a face mask while wrestling, which just wouldn't be practical anyway. So I think when you're looking at certain sports, you know, physical distancing and mask wearing would be extremely challenging. And that's, again, why they're characterized as higher risk. I think, you know,
I apologize. I maybe I didn't make it clear the question, Doctor. It was for individuals not actively participating in sports. So spectators and others, you know, I mean, it's certainly understandable if you've got kids participating in high risk sports, they're not going to maintain that physical distance. But this is for other individuals not actively participating. That was my question, and I apologize if I didn't say that correctly.
No, I misunderstood. So in terms of anyone else, I mean, the farther they can distance, the better, especially if they're in an enclosed space with, you know, inadequate circulation or ventilation.
Mm-hmm. Okay, thank you.
Legislator Arkwood.
Thank you, Mr. Chairman. Dr. Williams, I found it interesting in your report concerning Johnson & Johnson. But by the way, are they still pending the emergency use authorization?
That's right. That would be the next step that
Okay.
they have to go through.
And Mr. Chairman, if I could follow up.
Yes.
Thank you. I was listening to one of the major media outlets, and I didn't catch the physician's name, but an expert in the field. And he said that with the emergence of the variants, you know, coming in, that he thought it would be wise that we move forward in vaccinating just one time to try to get everybody vaccinated the one time, and less emphasis on that second shot. You had described that Johnson & Johnson, we're looking at a single shot. Is that conversation happening at the county level at all to try to get the entire population vaccinated one time instead of going one and then a couple or 3 weeks later getting a second?
So for both the Pfizer and the Moderna vaccine, you know, the recommendation is very strongly to get the second injection. There's been a debate on a national level, within the medical communities and allergy and immunology people about whether you could do one injection for more people and just get that second injection when you're able to. I think, one of the concerns that I have is, these vaccines, although we feel that they're safe and effective, we've just recently done the studies. I think anytime you do something under an emergency use authorization and then start modifying your approach, you're no longer guided by the science. And I think you're taking on some risk that is probably unnecessary. And to be honest with you, it's not really up to the county or the people who are doing vaccinations. This is decided at a state level. But my personal opinion is, I think these vaccines are safe and effective, but I think they should be used as directed by the science that we have. If somebody's able to demonstrate the safety of that alternative approach, then I think it should have more discussion.
Thank you, Doctor.
Legislator Kern.
Dr. Williams, thank you, Mr. Chairman. So Dr. Williams, I saw a 70 to, 75% effective rate on the Johnson & Johnson. So herd immunity is kind of different for every virus. Like the measles is in the high 90% that you have to have people vaccinated of the population for it to be effective. What do we think this coronavirus is? Do we have statistics on that?
So I think, for herd immunity, different percentages have been presented, as low as, I think 55 is the lowest I've ever heard. Some people think it needs to be up to 85. I think, like most things, it's probably somewhere in between the two.
And my other part of it is, have they looked at what just one shot is of the Moderna and the Pfizer? Like what percentage you get?
So after 2 weeks, and I believe it was the Pfizer, they were getting somewhere like 50%, 50% efficacy of the vaccine, which of course is different than the discussion about herd immunity.
Right.
So that would be the challenge. And that was, 50% after 2 weeks. It's possible that after one injection that your antibodies may wane more rapidly. There's lots of other factors that would need to be considered. And I think the science is evolving around this, and we might find that there are enough people who were inadvertently only vaccinated once, and hopefully we can see some reporting on what their outcome is. So I think there'll be more information coming along, but right now we should stick with what's supported in the scientific trials that were performed with vaccines.
Thank you.
Welcome.
Any other questions? Any more conversation? Yes, go ahead, Nicole Terminelli.
Thank you. Sorry, I know it's hard to see from across the room. One more question about the weekly testing that was put out in the plan is a recommendation, not a requirement. Is that right?
Yep.
And if schools chose to implement that to ensure safety, would that be something that they would have to do through the health system, Dr. Williams, or would that be something that school districts could partner with public health and do it within the school district themselves?
So, we could see what Dana says. Public health doesn't have access to the PCR testing.
Okay.
The New York State did distribute antigen tests.
Mm-hmm.
And again, the concern with the antigen test is it's a poor quality test, so you risk falsely reassuring people. And so there's lots of debate about it. Most of the studies with antigen tests demonstrated that if you tested people very frequently, like more than once a week, you may derive some benefit. But then you would have kids getting tested like 3 times a week, which would create another obstacle.
Are there any other questions? I don't see any other questions, so thank you very much, Dr. Williams.
Welcome.
Next we have communications, but I think we're going to skip
communications until after the people in the hallway have been waiting a long time have spoken.
spoken. And so with that, I'll make the announcement. Do you think they can hear me out there, Ruth?
Yeah.
Can I make the announcement now, or do we do it individually?
I would make it once loud.
Okay. At this time, there's a public participation that will be had. And any citizen who is waiting or wanting to address the board is asked to stand at the podium during the time of their address to the board, and the address will be limited to a time of 5 minutes. When you do stand at the podium, please give your name and your address. And the first person that we would like to hear from would be Brett Blackburn from Clifton. Come on in, Brett.
Sir?
Yes.
I'm in here and I'm not with the
Okay,
group,
well,
so
would you like to go first? Go ahead, we'll let you. Brett, hang on just a second. We've got someone here that's not with your group.
This is Brad.
Oh, you're Brett?
Yeah.
Okay, go ahead, Brett.
I'm Brett Blacksmer, 24 Mill Street, Cranberry Lake. I'm actually here along with Heather Wilson and Leo Burns from the Cranberry Lake Mountaineers Snowmobile Club. And Leo is also the New York State Snowmobile Association Secretary. All we're asking the legislators is to reconsider how the payments from Office of Parks and Recs are administered back to the Snowmobile Association. We're not asking you for any money. We're not asking for anyone's job. We are just asking for, again, to consider us receiving the money that we work for. Heather has many specifics, reasons in our club. I don't know, and real quick, the money is administered through the county by Soil and Water and then dispersed to St. Lawrence County Snowmobile Association. Also, Leo Burns from New York State Snowmobile Association could also shed light if necessary. That's all I need to say.
Okay.
I'm not sure if Heather is able to also jump in for the last 2 minutes.
Would you like to
Yeah,
speak,
I
Heather?
signed, well, I've been,
You come
I
to the
was, I
podium.
called earlier and I couldn't get in your back doors and I had a broken leg. And,
Bring the mic.
anyway,
Not snowmobile related.
not snowmobile related. I wish, I was so in a hurry to go snowmobiling and then I did this. So, anyway.
Okay.
Thank you. Heather Wilson, I wasn't living in Potsdam, I just moved to CB's Corners. My address is P.O. Box 494 South Colton. But I am in CB, I'm in Chalvold area. So thank you for letting me speak. We have 365 members of the Cranberry Lake Mountaineers. Our membership is just going up. 82 volunteers. They just can't wait to get out and work, and they're happy. And we look at it, and we just see some disparity. Our club in the last 11 years has earned over $800,000 in parks money. We get it through snowmobile registration only. So $45 is snowmobile registration. The state takes $5 off the top. The other 40 goes to a pool. They base it on funded miles. We have 142 funded miles for our club, of which, so that's about $50,000 a year, let's just round it up. So in the last 10 years, we have 3 groomers that we have from the county. Last 5 years, one of the 3 has never been given to, it comes in late or we haven't had it at all. We're trying to groom 160 miles, 180, correction, 180, but some of them are not funded. And bottom line is we've got old equipment that breaks down. We're in the southern part of the county where we have lots of snow. It generates a lot of income. We've got a lot of people with second homes who just love to ride, including me. That's why I moved to South Carolina. I just love to ride. It's my escape. Right now, COVID, it's a wonderful escape. We have American Legion in Star Lake that's busy all the time right now. Thank you for snowmobilers. There isn't a funded trail in Star Lake. Right now, the County Snowmobile Association thinks the trail in Waddington is more important. Not that I don't want to pit one against the other. That's not fair either. But we've got an area of the county that is a major portion of our business. We have people that also do what they call the big loop. They start out in Old Forge, they go up through Croghan, come in from Hamilton County into Star Lake area, and then end up over by CV and eventually back down around. It's about 180 miles. And people who ride snowmobiles 180 miles usually don't have old junkers. They've got new machines. They're spending money. They're trying to spend money in our county, and we've got junk equipment. Why? Because of that 800,000, the County Snowmobile Association's probably given us 200 back. They've taken 600,000 off the top, and they've spread it out all over the county, which is great if you're all over the county. It doesn't help our club. We've got 25% of the funded miles, and we've got some of the oldest equipment. And we asked for it, and we've asked for it. We couldn't even get a drag to go up Little Blue, which is like an icon. Any of you know that? It's beautiful. So we had to actually borrow a drag from Tupper Lake. They let us borrow a drag. And Leo out in Hallway, it's his UTV that were to do that. Because we couldn't even get that voted on at the January meeting. That's the frustration. That's why we went to Larry. That's why we've also come, out to different, just different people saying, we don't know what to do. The bottom line, we want fair. And fair and equitable doesn't mean you take an area that needs people, needs jobs, needs to draw in something out of the economy, and we just feel like we're stifled. That's why we just want autonomy. We want the money that we fund from our trails to go to our club. Just leave us alone, just get us our money, and that $800,000 would have gone to very good use. So I just want to thank you all. I know you guys work hard. So thank you for allowing me to speak. And I don't know if Leo got on the agenda or not, but
Thank you.
thank you so much.
Okay. I think I'll go off this list here in front of me now with Brooke Larrabee. Brooke Larrabee. Hello, Brooke.
Hello.
Would you please make sure you say your name and your address for us? You got 5 minutes to give us your little speech.
I'm Brooke Larrabee, and I live at 2 Haley Drive, Canton, New York. Fellow legislators, fellow students, and parents. My name is Brooke Larrabee, and I'm a senior at Canton High School. I would like to take a second to thank you for allowing us to speak tonight. Just imagine, the bell rings, and this feeling of relief fills your body. School is done, and you head to the lobby to meet up with your friends. You get there as the football players are blaring music in the team room, and the soccer players are rushing to get out to the field. You wait around for half an hour, messing around, then you go get changed for swim practice. You see everyone, catch up on the latest news like all girls do. You dread it, but you go to the wrestling room to stretch, followed by the pool. It's freezing when you dive in, but you know the cold will go away quickly, and you have to put the time in because you have a meet on Friday. After practice, you drag yourself and your aching muscles to play rehearsal. You light up when you see your friends, knowing that this is going to be an amazing way to end your day. Being on stage with peers and laughing because there's utterly no way to get through rehearsal without laughing. Then you go home, pump out some homework, go to bed. This was my life a year and a half ago. And I miss it more than anything. I feel lost without it. Now when the bell rings at 2:30, I go home, sit on my couch, do some homework, go to bed, and do it all over again. This is our reality and nobody really likes it. Really, we as students don't have anything to look forward to. I know I'm not going to practice after school, or play rehearsal, or even Mrs. Bush's room to just hang out. We're either going home to look at a screen to do homework, or shutting our computers just to open them back up in a few hours. This is why we need something. We need sports, music, and extracurriculars. We need something to look forward to. And for some people, they need it to get out of the depression that they're in. I personally know people struggling mentally through this pandemic, and they're not the only ones. They need something to look forward to. We are aware that Section 10 has developed a plan that works within the Department of Health COVID safety guidelines, and we appreciate that the Department of Health has worked hard to move forward with the approval process. I think that if this plan is approved by school districts, it would be a great way to give students a chance to be normal and happy. This year is really sad, and it needs to end happily. Speaking from a senior's perspective, I've gotten nothing, and we've already lost so much. This is our last chance as high school students, and we're running out of time. It's easy to give up out of fear for what might happen, but it's honorable to try for what might be, especially that the state has told us we can. Other counties and other sections are figuring it out, and we should be able to do the same. For any superintendents listening, I'm begging you, please give us a chance. I'll leave you with this. What's more harmful to teenagers? The risk of COVID-19 or the mental and physical issues that are happening to kids in this area because of the lack of extracurricular activities? We need these activities to better our health and give us something to look forward to. I relinquish any remaining time to Andy Frost.
If you want to come this way when you leave, you can go right through this way. Follow the yellow, follow the arrows. Follow the arrows. Thanks for coming.
Next person to come in to speak is Caleb Durenzio. Did I pronounce that word right?
Duranzo.
Duranzo. Okay, thank you very much. Good.
All right, my name is Caleb Duranzo from Messina. I live on 12 Chestnut. I'd like to thank you all for having me here. So I think we should be playing winter sports for many reasons. One reason is because there's more cases in the Buffalo area than here, and they're still playing. We will all wear masks if needed off and on the ice. Sports are the only getaway that some kids can have in a day, and without sports, they can't have that. And currently, mental health is awful due to no sports. There are a lot of cases in the county that we're aware of, but not all of them are in our age group, and a lot of it is due to teachers in prisons. The National Federation of High School Sports says hockey is not a high-risk sport, but a moderate sport. As of January 31st, Cuomo announced the New York State 7-day average of COVID-19 positivity rate has declined for 23 straight days. Kids from all across the North Country who play hockey play on different teams than just their hometown, and there has still been no positive cases. A recent study conducted at Eastern Michigan College says U18 age of hockey players sustain less than 3 seconds of actual physical contact during a game, which is less contact than soccer, and soccer was played in the fall. Medical experts have confirmed that if all the proper precautions are followed, it is safe to play ice hockey, and we all plan on following the proper precautions. Positive rates are high right now, but plan on following all procedures to bring cases down. Sports is the only reason that some of us even go to school. It feels like every day is the same day on repeat. I relinquish any remaining time to Mrs. Frost.
We'll come right this way. Yep, just follow the arrows right on through. Thanks for coming.
Talon Wiley. Fort Covington.
Hello, my name is Tyler Wiley, and my address is 2170 State Route 37, Fort Covington, New York. I'm here to represent the athletes from San Minerva Central School District. I'm in 12th grade, and I play varsity hockey. I've been playing for 3 years, going on 4, starting in 9th grade. Since the beginning of the pandemic, it has been a fear of mine that I would never get my senior year. When that fear started happening and becoming true, I became devastated. At first, we started off with only remote learning, and then things took a turn for the better, and we were able to go to school and play some of our soccer season. When everything suddenly started going bad and the thought of no hockey became a reality, I couldn't believe it. We had the slightest hope when we were told high-risk sports could commence, but then it all changed in a second. I am deeply heartbroken and outraged that I will not get the opportunity to have a senior night to celebrate all we have gone through and to celebrate our accomplishments. I am sorrowful that I won't have my last opportunity to play for my school and community and to teach my younger teammates as I have been taught. My senior class was huge, and we have been the youngest for so long. It is now our time to shine as seniors, and it is being ripped away from us. There are no do-overs, and we will never get this time back. We have not had much this year, and this is the only thing we ask. I want to be able to play one last time and do the thing I love most. The thing I have looked forward to since I started playing at age 4, the thing that makes me happy, playing hockey. I want to thank you for your time and listening to not only mine, but the concern of all student athletes. I relinquish any remaining time to Angie Frost. Thank you.
Thank you.
Thank you.
Trent Sargent, Augsburg.
Trent Sargent, 14 Academy Place. Good evening. My name is Trent Sargent, and I'm a senior at Ogdensburg Free Academy. I'm very grateful to have the opportunity to speak on behalf of my peers tonight in front of you all. On Friday, January 22nd, Governor Cuomo approved the start of high-risk sports in New York State, an announcement that was met with jubilation by student athletes across New York State. A week later, on Friday, January 29th, Section 10 announced that we were on pause and we would not be starting our seasons on the following Monday. To state it bluntly, to have the sense of hope we all felt on January 22nd stripped away in the form of a press release, or to hear it on the 6 o'clock news with no available outlet to ask questions or to receive help understanding the decision was incredibly painful and, in my opinion, absolutely unfair. Now, I couldn't speak on how sports are directly linked to kids' mental health. I could speak on how sports are directly linked to kids' attendance at school and their grades. It is my sincere hope that the people deciding the fate of athletics are well aware of this information. I would rather at this point present you with what are, to the best of my research, the facts. As of Friday, January 28th, 44 other states in the country are playing high school sports. According to NISPA, 35 other counties in New York State are starting high school sports today. And according to the New York State Department of Health website last Friday, 24 of these counties had a higher daily infection rate and a higher rolling 7-day average infection rate than St. Lawrence County. I have personally not yet heard of an outbreak of COVID-19 due to these sports being played with players wearing masks. I'm left wondering why our section cannot put on a season like the majority of the country, given our infection rates. By delaying this season, I am left to assume, as no dialogue with student athletes has been afforded to them to ask questions and receive answers, that the decision makers believe that they are slowing the spread of COVID-19. In actuality, however, it may actually lead to a greater chance of increasing the spread. The more time spent waiting for the unknown start date, the more unstructured time kids have on their hands. We cannot be naive. This means kids are spending their time in what could be a monitored and rule-regulated practice or game while wearing masks, are setting up their own games with no masks or sanitary protocols. With no sports, this also means a lot more time for kids to gather on their own. either in big or small groups, again, with no masks, no social distancing, and no sanitary protocols. This is far more likely to increase the spread of COVID-19 than would be putting 15 to 30 people in a gym or a rink with masks and other safety protocols in place. Obviously, there are risks involved with commencing sports. But if we look at our local restaurants, stores, and even eating conditions in many of our local schools, there are also risks involved every time you walk outside of your house. The curve has been flattened and we have done what is asked of us. Now it is time for the people in power to hold up their end of the deal. To put it in perspective, the same people who create the guidelines for our state and county's health have said that it is acceptable to start high-risk sports. These people have medical degrees and have studied the virus. The people telling us that it is unacceptable to start sports have degrees in education and administration. The point of my speech is not to belittle or offend anyone. I'm not questioning anyone's legitimacy in their profession. What I am questioning is their judgment in a situation where the decisions made are opposing the decisions of the experts and the decisions of most of our country. I sincerely hope that our section can review the decisions that have been made, carefully consider decisions in the immediate future, and share them with student athletes in an appropriate manner, and can give student athletes the chance to play, adhering to all safety protocols recommended by our Department of Health. It is a chance we deserve. Thank you. I relinquish any time left to Angie Frost.
Move this way
Thank
and
you,
follow
Jen.
the arrows. Thanks a lot.
Angela Frost. Messina.
I'm Angela Frost. I live at 25 Windsor Road in Messina, New York. Hello and good evening. I want to thank the County Board of Legislators for the opportunity to speak tonight. My name is Angela Frost. I live in Messina, New York with my husband and 4 children. 3 of them are enrolled at Messina Central School District and 1 is a recent graduate. Additionally, both my husband and I are prior graduates of Messina Central. I am here tonight advocating for our student athletes. I'm also here to bring awareness to the mental health crisis that is happening to all of our children and begging for help in front of you. Since we were first hit with this pandemic in March, our kids have had the rug ripped out from underneath them more times than I can put into words. As the landscape continues to change on a regular basis, they continue to adapt and pivot on a dime. From remote learning, in-person learning, masks, hand sanitizer, contact tracing, quarantine, you name it, they've had to continually adjust, yet they continue to do so without complaint. Most of these words they probably had never heard of prior to March of 2020. Not only in our school district, but throughout Section 10 and the nation as a whole, depression and anxiety are at an all-time high among all of our children. They want and they need an outlet from the seclusion this pandemic has brought upon them. Their social interactions have been limited to their computer screens and personal devices. Recently, when the governor made the announcement that high-risk winter sports could start beginning February 1st, with the approval at the county level, it was the first time we actually saw some hope in these kids' faces. That day, kids were calling and messaging each other, screaming of happiness, moms, including myself, calling all the moms, so excited that we might actually get a senior night. For the first time in a very long time, I saw hope in my kids' eyes for the future. Then it happened again. The rug was ripped out from underneath them on Friday, as we were devastated when we heard the news that St. Lawrence County Public Health had given us the go-ahead with guidelines, yet our district leaders had said, no, we aren't ready. I'm trying to understand how they cannot be ready, or at least have been a little prepared. My best friend's son lives in Section 3, which is the Syracuse area for people who don't know the sections. They are approved to play hockey and are on the ice currently doing their tryouts. When I was just down there a couple weeks ago, I couldn't even eat in a restaurant because the percentages were so high. This is due largely to proper planning in advance, holding meetings and considering all the possibilities instead of waiting, then reacting. But we are being told that we can't start today. Is this because our infection rate numbers, which I checked on the way here, is at a 4.1% in St. Lawrence County, is too high? I feel it is relevant to note that these numbers, from what I'm told, are including inmates and in-person nursing homes who have no contact with their student athletes. Of the 34 counties in New York State that have approved high-risk winter sports, 19 of them are currently having a higher infection rate than us in St. Lawrence County. I feel it is also important for this body and others to know that the sport of ice hockey has been actively practicing for 3 to 4 days a week since August. In some cases, or with safety protocols in place at all the arenas that the kids have played at. When the governors announced no contact ice time, there have been clinics across the North Country for months with players participating from many different areas of the North Country. These players have again adapted to the required protocols, getting dressed at home, driving with equipment on, and not using locker rooms, wearing masks when required, filling out online forms to track attendance, and getting temperature checks. During these past 6 months of ice hockey participation across a wide age group from 4 to 18, I do not know one single documented COVID contraction from the arena. Players have only had to miss these sessions because they were contacted by someone outside of their sport, usually an adult. I know and understand that the virus continues to be a threat. In my profession, I work daily with the public and have to follow the necessary protocols that come with that. I also work closely with a lot of our frontline workers. But on a daily basis, I'm also seeing the devastating ramifications to our children's mental health when they have absolutely nothing positive to look forward to. Sports would force people into controlled environments. With safety protocols in place, there would be mask wearing, social distancing, and attendance tracking. During his weekly news briefings, Governor Cuomo repeatedly notes that the highest place of transmission is in your house, 73%. It has been further documented and proven that in-school transmission rate is around 0.046%, and that sports is at 1.2%. These are the statewide numbers. Local numbers will definitely be substantially lower. We are constantly told to follow the science and to listen to the research. So I'm asking for logic to play a big part of getting the answer here. Let's get people out of their living rooms and allow them to enter controlled environments, and you will see the numbers start to drop. Additionally, as the distribution of the vaccine continues, this will only assist in helping things get back to some sort of normalcy. Our kids need to be in school and playing sports, and they need your help and the help of other primary decision makers. If any of you are high school athletes, please think back and picture yourself wearing your school colors and thinking of the memories of what you had on your day. Now just imagine if those memories were taken away from you, not because of a pandemic, but due to the failure to adequately prepare during the time of the pandemic. Tonight, if you look around the hallway, I have the room, you will see many different faces. Many team colors and many sports are here representing. Some, who I'll tell you, have been pretty big rivals in Section 10. But tonight, we are here together as one team for Section 10, begging you to see the advantages of allowing them to play and asking for your help. For their future, for their mental health, and for their memories, please help let them play. Thank you.
Thank you, Angela.
Thank you.
Thank you. Thanks a lot.
Thank you.
Next, we have Cassie Hayes from Parrishville.
First, I want to thank the St. Lawrence County Board of Legislators for listening to the concerns of our children and parents throughout the county. As stated, my name is Cassie Hayes, and I live at 231 Sylvan Falls Road in Parrishville with my husband and 3 children. 2 of my children attend Parrishville Hopkins Central School and play sports. I am a middle school teacher at Messina Central School and currently on the Potsdam Figure Skating Board of Directors. I'm not really sure where to start, except that we need your help. We need your voice to advocate for our kids that live in the districts that you represent. The Potsdam Figure Skating Club has over 113 kids enrolled in our program since October of 2020. We've not had one positive case linked to any kid at our rink since our program has began. The Malone Minor Hockey Association has over 275 kids enrolled in their hockey clinics. These clinics have been up and running since September of 2020. Again, there's not been one positive COVID case linked to their program. These programs have been following diligently the CDC, DOH, New York State County Health Association's guidelines. According to the governor's report on COVID-19 today, we are at a 24-day decline in infection rates. His report also states that our hospitalization rate is at the lowest it's been since March of 2020 across the state. Our kids have been lost in the pandemic and are suffering from it. Our kids have been sidelined during this pandemic with no games on their upcoming schedule, no indoor batting cages or other venues to hone their skills. Unfortunately, they are not lucky enough to play for the NBA, the NHL, or Division I college, who are all playing right now. One doctor once quoted saying, "Our kids don't need to get the virus to suffer from it. Just being told that you're not important, you're not essential, you're not needed, sit over there for a couple of years while we sort this out, is enough for the kids to feel empty." These kids are used to playing hockey and other sports 5 days a week. It is who they are. They wear their jackets and it defines their personality. When you take that away from our kids, they're left with a huge hole. That hole is filled with the desperation and anxiety. Brennan Doloff could always count on his hockey to help him get through anything he was dealing with. He was a senior at Mona Shores High School with a 3.8 GPA, looking forward to his senior year. He loved fishing, hunting, and jet skiing. Slipping on his number 22 jersey again meant everything to him. His hockey team was an extension of his family and carried a far greater impact than any win or loss on the scoreboard. His parents, Brian and Rona, could see the devastation on his face every day and the struggles he was dealing with. Brennan took his own life on January 18th. The shock rippled through the hockey community and sports communities. Please don't let this happen to our kids. We need to weigh the benefits versus the risk for our kids. The director of the Department of Health, Howard Zucker, put out a memo dated March 9, 2020 titled Reopening New York Schools. Reopening New York. The memo discusses in depth the mental health risk to children. This was over 11 months ago, and now the toll that is taken on our children every day in the classroom, and I see it every day with the kids that I teach every day, and my own children is beyond words. Please remember what Herb Brooks' wife stated in the movie Miracle on Ice. It's more than a hockey game. It's truly more than a hockey game to our communities, our parents, and most importantly, our kids. Please help our kids and support our kids to establish sports. Thank you.
Thank you, Cassie.
Yep, keep coming. You're good. You're gonna go right through there.
Michael Tremboli, Messina.
Thank you. Thanks for your time and consideration in hearing this matter. My name is Mike Tremboli. I live at Fort Heritage Place in Messina, New York. I wear several hats as I come to you today. I am the coach for the Messina High School hockey team, but also I'm a vice president with USA Hockey, the national governing body of youth hockey in the United States. And I'm also president of the Hockey Coaches Association in New York, which represents all high school hockey teams and coaches, both Federation, boys, girls, and Catholic schools. I've been involved in coaching high school hockey at 2 different school districts over the course of 27 years. I have children who are athletes. One of the big things that I was asked to come here and talk to you about today was to debunk some rumors and some things that are speculation that are out there. Just during the presentation today, the St. Lawrence County Public Health Director showed a slide about an infection during a hockey game where people were infected. It was a picture. She didn't go on and show why that happened and what they found in their research. At USA Hockey, we've developed a document that I'd be glad to share with everybody, and there's other documents that I'd be glad to share with everybody for you to look at, facts. And I'll read to you what a document that we have, responding to speculation of enhanced risk of hockey related to COVID-19. There's been speculation through recent stories in the news media to suggest hockey is riskier than other youth sports and activities related to COVID-19, and specifically the rink environment. Speculation is the key word. And there's no specific evidence to back up that speculation. We reject the premise that hockey is riskier than other sports or activities relative to the pandemic. And with any sport, we have always acknowledged there is some risk associated with playing hockey. To help leaders in hockey, we've developed a document to add context and commentary around some of the things that have been recent news reports. And this document gets updated regularly. The important thing here is that this information and commentary included within is developed with the guidance from our medical experts, led by Dr. Michael Stewart, Chief Medical and Safety Officer for USA Hockey from the Mayo Clinic, who has access to a wide network of subject matter and experts at the Mayo Clinic and beyond. And Dr. Debrick Anderson, a noted national infectious disease expert and epidemiologist from infection control education of major sports, who has consulted with major professional sport leagues and other entities included in the NHL and NFL. The interesting part and why I bring this up is because in our document, it brings up the October report. The CDC detailed a large outbreak in Florida among amateur hockey adult players who on 2 teams that played each other but had no other contact. Investigators speculated that the indoor space and close contact increased the risk of infection. Our commentary from our medical experts and epidemiologists: the adult game was played in June of 2020. It is not known if the infections happened at the rink. Were players asymptomatic from both teams ahead of getting together? Did one player infect all involved? Did these players follow risk mitigation guidelines? While we appreciate the efforts of the CDC, this report is essentially speculative and does not share any conclusive scientific evidence. And that's just one example. Like I said, I'd be happy to share this document with you. There's also a document, as Caleb mentioned, from Eastern Michigan University that concludes that under 18 age hockey players sustain less than 3 seconds of actual physical contact during a game. This duration of individual physical contact in ice hockey is less than what's found in both soccer and field hockey, both sports which were completed in the fall without issue. Medical experts have confirmed that taking appropriate actions, it is indeed safe to play hockey. And it was also mentioned the National Federation of High School Sports, who oversees all sports across the nation, has classified ice hockey as a moderate risk sport. New York State themselves elevated it to high risk. Hockey players wear completely covered from head to toe with protective equipment. Soccer and field hockey players wear only cleats, shorts, jerseys, and they were granted permission. The ice hockey community has demonstrated a willingness to have players wear COVID masks, and there's manufacturers that have specifically engineered these, and they're for sale, and we have them for our team. And on behalf of the Coaches Association, we have acknowledged that we will have our players wear that, and coaches will wear them on the bench. We're willing to take the steps necessary. Such masks are readily available for anybody from major manufacturers. There's talk about indoor air quality and speculation about the virus in cold environments, how it lingers and is able to infect people more readily. High school hockey is played off-campus facilities that are regulated by the EPA and New York State Department of Health with respect to indoor air quality. Air must be monitored and exchanged on a continual basis to remove exhaust fumes from ice resurfacing vehicles, commonly known as Zambonis. In an effort to support the physical and mental well-being of our children and their school opportunities, we respectfully ask you to consider the science and evidence presented. We cannot emphasize enough the concern we have for the emotional well-being of our children. Since all New Yorkers began working together on COVID last spring, the youth in our community have demonstrated a willingness to protect themselves. I'm going to skip ahead because I just got the 30-second warning. Didn't know if there'd be some carryover time. Dr. Andrew Williams stated in his presentation that controlled environments have a less positivity rate. Players have been playing in controlled environments for a period of time now, 0 infections, because facilities have these approved safety things in effect. I'm going to end. We teach our players to fight through adversity, that winners find a way to be successful. As adults, we need to set the example and show our kids that there is a way. Right now, there's a lot of what ifs about failure. What if this happens? What if that happens for failure? Well, what if we succeed? What if we find a way? What if we use these safety plans and we show that we can succeed, as has been proven through youth hockey? Proper planning and execution of safety protocols. If we want to find a way, we will find a way. The want has to be there. Thank you for your time. I apologize for going over short.
Thank you, Mr. Gramble.
I'm gonna read out that way. Thank you.
Yep.
Thanks for coming.
Out there, anything? Guess it said everybody's on that list to call.
Yeah, maybe just ask if anybody else is waiting to speak.
Okay, let's move on to communications now. Kelly, do you have some communications for us?
I do. I have 6 communications.
Okay, Kelly.
Can you hear me okay?
Yeah, we can hear you.
Okay. The first one is from the leadership team of the New York State Poor People's Campaign of the North Country Committee. It's John Tenbush of Waddington, Jamie Merkel of Canton, Ramatha Pillay of Colton, Jacqueline Ryan of Canton, Gary Van Kennen of Messina, and Teresa Veramende of Canton. They say, we write to express our concern about the police reform efforts that the St. Lawrence County Board of Legislators has approved at its special board meeting held December 21st, 2020. As we know, Governor Cuomo issued Executive Order number 203 on June 12, 2020. This order requires local governments to perform a comprehensive review of current police departments and practices and develop a plan to improve such and to address any racial bias and disproportionate policing of communities of color. The deadline submitted is April 1st, 2021. It is clear that Executive Order 203 places responsibility on the Board of Legislators to do a comprehensive review and to address bias and disproportionate policing. We ask if the board is aware of data that shows disproportionate policing of communities of color in St. Lawrence County. The New York State Division of Criminal Justice Service published data for 2019 arrests and sentences by race, ethnicity for the state and for all counties. The tables include adult population figures by race, which allowed for comparison by race of arrest, felony arrest, and prison sentences. According to the tables, in 2019, adult persons of color, POC, made up 7% of the population in St. Lawrence County. However, POC made up 15% of all arrests and 21% of all felony arrests. POC made up 25% of those sentenced to prisons. These figures are disturbing. Persons of color are arrested at more than twice their percent of population. Are we to conclude that POC are twice as likely to commit crime? Or there may be other factors at work. POC are arrested and charged with felonies at a rate 3 times their percentage of population. Again, are we to conclude that POC are likely to commit more serious crimes than whites? Or might there be other factors? Finally, 25% of prison sentences are imposed on persons of color, more than 3 times their percent of population. By contrast, whites are sentenced to prison at a rate that is 18% lower than their percentage of population. We ask, has the board made sure that its police reform review process has engaged the above evidence of disproportionate policing? The next one I have is from Ramatha Pillay, STEM educator, North Country Poor People's Campaign leadership member. Dear St. Lawrence County Board of Legislators, I am writing to express my concern over the apparent rush to vote to accept changes proposed by Sheriff Brooks J. Bigworth to fulfill the requirements of Governor Andrew Cuomo's Executive Order 203 at the board meeting on December 21st, 2020. My concern stems from personal observation and experiences given the current circumstances of the pandemic and other stresses in our lives. Objective of EO number 203, has the board or the sheriff engaged in unrepresented group of people of color in our community regarding number 203? My interpretation of Executive Order 203 has this as an essential part. If the conversation were just with the usual stakeholders, this allows boxes to be checked, but does not meet the objectives of number 203. Engaging with the usual preferred stakeholders regarding reform does nothing to increase trust and confidence in any organization. Instead, it further enhances the very inequities attempting to be rectified. This executive order often refers to undermine the public's confidence and trust in our system of law enforcement and criminal justice, and such condition is ongoing and urgently needs to be rectified. Stress of the moment. In this time of the pandemic, most people have an overarching and constant stress in their lives, which reduces the mental bandwidth for daily life choices. I've noticed this in my life as an educator. I see it in the lives and performances of my students and colleagues. Add to this the busyness of the holiday season, and it is easy for important dates and tasks to be overlooked. At the December 21st meeting, at least 2 board members requested the vote to be tabled, stating that constituents contacted them regarding difficulties in joining the meeting to express their comment. Given all of this and the fact that the deadline for submission of the reform plan is April 1st, 2021, more than 3 months away, decided not to wait a few weeks for the community input seems negligent to me. To me, this decision to move ahead with the vote shows the opposite of number 203. Government has a responsibility to ensure that all its citizens are treated equally, fairly, and justly before the law. History of relationship. I believe the spirit of number 203 was not embraced. Many marginalized communities are easily intimidated by the authoritative demeanor of law enforcement, which stems from the history of power imbalance. I believe in many law enforcement and also the favored population, the wealthy white, don't understand what impact of that power imbalance, if they are aware of it at all. This is an important reason to take time to engage in conversation to build this trust in law enforcement. I think it is a missed opportunity for the board to have closed the conversation so quickly, months before the deadline. The fact that the sheriff had worked on this for several months is not reason enough to deny the public opportunity to engage in conversation and for the sheriff and others in his department to learn from those they are elected to protect. This executive order repeatedly brings up trust and in particular to develop practice to better address the particular needs of communities of color to promote public safety, improve community engagement, and foster trust. Representation. Finally, I would like to remind the members of the board they represent the entire community, and that includes those they might consider the least of us. Members may or may not be aware or may choose not to acknowledge that more than 1,000 people marched in Potsdam at a BLM rally, and hundreds attended other rallies throughout the summer and fall. Executive Order number 203 is clearly directed to address the call to action of these rallies. As our representatives, this community cry for justice should have been considered when deciding to vote on the issue or allow more community input, as stated in Executive number 203. For the purpose of addressing the particular needs of the communities served by such policing agency and promote community engagement to foster trust, fairness, and legitimacy, and to address any racial bias in disproportionate policing of communities of color. I am aware that personally, some on the board might see no need for police reform or see no discrimination. I would hope that you would consider this matter in a professional light and engage in professional development to learn more about these discriminations. Executive Order number 203 attempts to address through conversations with groups of communities you are unfamiliar with. The next one is from Jamie Merkel, North Country Poor People's Campaign Leadership Community Member. She did not state where she was from. Oh, Canton. She's from Canton. I am writing to voice my concern regarding the vote to accept the proposed changes by Sheriff Brooks J. Bigworth to fulfill Executive Order number 203. I would like to echo some of the points made in the letter published by North Country Poor People's Campaign leaders in the Watertown Daily Times. It was negligent not to wait a few weeks to receive additional community input before voting. This vote was taken 4 days before Christmas in the middle of a pandemic, and Mr. Fay raised valid concerns to delay the vote after hearing from constituents who couldn't make the meeting. It truly was a missed opportunity to have closed this door well before the April deadline and not allowing for additional community input. I acknowledge Sheriff Brooks J. Bigworth's sentiments that the public has had many opportunities to be involved. However, I believe additional opportunities for the public to be involved and voice their opinion was needed. Other local police departments have given more opportunities using various methods of inclusion to encourage community input and discussion in the process. Many of the Potsdam Police Advisory Committee meetings in St. Lawrence County have been open to the public, but the lack of publicity around when and where the meetings take place and how community members are able to participate has been confusing. The lack of information located on the Sheriff's Office page is one example of this. Additionally, holding Police Advisory Committee meetings during work hours combined with the general stress of COVID-19 pandemic and the holiday season has made attending these meetings difficult for me and other community members I have talked to. Per the January 15th update on the Village of Potsdam Facebook page, I am very much in support of community input opportunities of surveys, community involvement in subcommittees, and community input in the draft report to the governor. I think the Canton Village Police Advisory Committee did a good job of choosing a cross-section of the community to be at the table and having on their website a survey for the public to comment on the proposal, something the sheriff could learn to do for engaging the community in the process. What I do not understand, if this work is still ongoing in other local police departments, why the board voted to accept Sheriff Brooks Big Wharf's proposes change on December 21st when the deadline is not until April 1st. The next letter is from Jane Lammers. While I have not been personally involved with the current public controversy over the local response to Governor Cuomo's executive order, I understand that representatives of marginalized people locally are requesting additional interaction and the opportunity to be heard relative to the proposed response to this order. I further understand that the deadline for submitting a new policy is April 1, 2021, so would assume from that adequate time to pursue more interaction with the community is possible. The fact that both Black members of the local task force resigned in protest is not complementary to the process to date. Perhaps it would be preferable to spend more time upfront to comply with the governor's order than to have the governor's office disapprove of the plan submitted. I believe that the intent of the order was for the communities to make good faith efforts to respond to concerns and any documented inequities in treatment and policing. While I have not personally witnessed this type of incident, I do have personal knowledge from Black friends who have experienced unusual treatment. It would do well to solicit more community input. The next letter is from Becky Allen of South Colton. Some of you will be sitting at the meeting tonight not wearing masks, if past meetings are any indicator. Against the guidance and advice of our own public health department, your own medical director, and our CDC. This is not how leaders lead. I know some of you will insist that maintaining 6 foot of distance makes mask wearing unnecessary. Not true. Non-pharmaceutical interventions require a combination of strategies to be effective. It is not an either or proposition. To use a North Country analogy, you wouldn't go hunting with a gun and no bullets, not if you wanted to be successful. Some of you also made the decision to push back against New York State pause orders that have proven effective in reducing the transmission of COVID. Instead, you decided to make political hay and expose us all to greater risk by opposing the enforcement of proven strategies that would protect this community and reduce the number of hospitalizations and ultimately the number of deaths. This is not what we expect from our elected officials. Now I know some of you, and I know you care about this community. Start acting like it. The bottom line is if you don't lead by example and support your own experts, the community will be harmed. It's that plain and that simple. We have lost 67 people in this county to COVID in less than a year's time. With the new variants on the horizon and 2 more months of winter to go, we need you to show true leadership now more than ever. Wear your mask, trust the experts, promote vaccinations, collaborate with state leadership, Work across party lines, demand better of all of us in following the protocols, and focus on responding to this pandemic, not political grandstanding. I would also implore you to support by proclamation the rescue bill as proposed by the new federal administration. This is not the time for half measures. You are well aware that there are many in this community who are suffering from the result of devastated economy. Our well-being and the economic future of this county and all those who call it home relies on a robust investment by the federal government. State and local governments cannot do this alone, and previous stimulus relief efforts have been insufficient to the task. Please be real advocates for real investment capable of bringing relief to all of us. Finally, I want to publicly thank our hardworking public health department. Despite being underfunded, overworked, and up against relentless, deadly pandemic, they go to work every day and serve this county and its residents with competence, compassion, and grace. They deserve recognition by this board and the sincerest gratitude of all who call St. Lawrence County home. To those of you on the board who have followed the science and the public health guidance, a sincere, heartfelt thanks for your effort to protect this community and lead by example. And the last one is from Jennifer Mitchell of Colton, New York, and she writes, Congresswoman Stefanik and county legislators. Representative Stefanik, I ask you to stop attacking local media who provide factual balanced reporting. They are asking very basic questions about your record, but you respond with cheap attacks. It's embarrassing and it's dangerous. Representative Stefanik, please stop attacking Governor Cuomo and focus instead on providing real solutions for the massive crisis we now face. Most importantly, Representative Stefanik, please take responsibility for your role in supporting the former president's false claim of a stolen election. Please admit to your district that the 2020 presidential election was valid and secure. You signed on to the Texas brief, lied on the House floor about elections in 4 states, and voted against certifying the results. If you do not correct yourself publicly, it is clear that you are ready and willing to do it all over again. We all see where that gets us. It really feels like you're using our district as a stepping stone and don't care what damage you do to our confidence in election and our ability to work together within the district. County legislators, I request that you also make responsible statements on these 3 issues: the media, the governor, and the presidential election, despite Representative Stefanik's dangerous rhetoric. Thank you.
It's now time to move on to the presentation of resolutions. Ms. Kern.
Sorry, I thought this was going to be later. And I don't have a copy of my resolution that, well, maybe, hold on.
The first one is authorizing the purchase of body cameras, page 2.
Sorry. Can you hear me?
Yes, I can hear you.
So I have a resolution authorizing the purchase of body cameras for the sheriff's office and modifying the 2021 budget for the sheriff's office, and I move that resolution.
And Mr. Denisha seconds it. I think we have a roll call vote.
Yes. Oh, and I made it back.
Kelly? Kelly, can you hear me?
I can. Sorry about that. I'm having issues over here.
That's okay, Kelly.
I'm all set. Yep.
Thank you.
Piazza,
Yes.
Burke,
Yes.
Barquette,
Just tell people.
Terminelli,
Yes.
Curran,
Yes.
Reagan, Mr. Reagan.
Yes. Yes.
Forsythe,
Yes.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay, Mr. Fay,
Yes. Yes.
Haggard,
Yes.
15 yes.
Motion carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution authorizing the chair to sign the Stop DWI 2021 plan for the New York State Governor's Traffic Safety Committee and move for its adoption.
Second by Mr. Smithers and Mr. Perkins. Any discussion? No discussion. Anyone, all in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution accepting a donation from the Seaway Valley Prevention Council for the Community Services Chemical Dependency Clinics and move for its adoption.
Oh, and second by Mr. Smithers. Any discussion? All in favor?
Aye.
Opposed? Carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2020 budget for the Public Health Department for the Health Research Incorporated COVID-19 Response Grant and move for its adoption.
Second by Mr. Denisha. And Ms. Curran. And we'll have a roll call vote. Before we have a roll call vote, I think I forgot to say discussion. Is there any discussion on the matter? No discussion? Okay.
Mr. Burke.
All right. Go ahead with the roll call.
Yes.
Mr. Burke?
Yes.
Mr. Burke?
Terminelli,
Yes.
Curran,
Yes.
Reagan, Mr. Reagan,
Yes.
Forsythe, Reagan,
Yes.
Forsythe,
His camera just went off. He must have lost battery.
Lightfoot,
Yes.
Yes.
Sheridan, Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Drexel,
Yes.
14 yes.
Motion carried. Mr. Lightfoot.
Mr. Chairman, I offer a resolution modifying the 2020 budget for the Public Health Department for the Epidemiology and Laboratory Capacity COVID-19 Grant and move for its adoption.
Is there a second? Mr. Smithers, Mr. Perkins? Any discussion? No discussion? Okay, roll call vote, please, Kelly.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan,
Yes.
Forsythe, Lightfoot,
Yes.
Sheridan,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha, Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Jacko,
Yes.
Burke,
Yes.
14 yes.
Carried. Mr. Akers.
Mr. Chairman, I have a resolution authorizing the chair to sign a contract with New York Power Authority for the installation of a culvert on County Route 39 to facilitate the Smart Path Moses Adirondack transmission lines to protect and modifying the 2021 budget for the Department of Highways, and move this resolution.
Is there a second? Mr. Lightfoot makes a second. Mr. Smithers seconds. Any discussion? Tony Arco.
Thank you, Mr. Chairman. I have to abstain from this vote due to my primary employment.
So noted, Tony. Any other discussion? Ms. Terminelli.
I will also be requesting to abstain from this vote.
So noted. Any other discussion? No further discussion. We'll have a roll call vote.
Terminelli,
Abstain.
Curran,
Yes.
Reagan,
Yes.
Forsythe, Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Jacko,
Yes.
Burke,
Yes.
Arquette,
Abstain.
12 yes, 2 abstain, 1 absent.
Motion carries. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing the chair to sign a contract with the United States Department of Agriculture Animal and Plant Health Inspection Service and Wildlife Services for an intergovernmental cooperative program. I move this resolution.
Second by Mr. Smithers. Any discussion? No discussion. All in favor?
Aye.
Opposed? No one opposed? Carried. Mr. Akers.
Mr. Chairman, I offer a resolution to modify the
Go ahead, Mr.
modifying the 2020 budget for the Department of Highways for overtime, equipment repair, and maintenance. I move this resolution.
Is there a second? Mr. Smithers. And is there any discussion? Go ahead, Ms. Haggard.
Mr. Chairman, I'd ask that people who aren't speaking turn their microphones off because there's there's a lot of background noise for the people who are listening. So if they're on Zoom, I'd appreciate that. I think that people watching would too. Thank you.
I couldn't hear all that much what you said, but I think you're telling everybody to turn their mics off if they're not speaking.
Yes.
Okay, I agree with you. If If you're not speaking, make sure you turn your mics off because we are having difficulty trying to hear what you're saying. Meanwhile, mine's off. Let's speak. Okay.
What did you say?
All right, so where were we on this resolution?
It's been motion seconded.
It's been seconded, and we need a roll call vote on this. This is the modifying, I believe. So roll call vote.
Curran,
Yes.
Reagan,
Yes.
Forsythe, Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piacco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
14 yes, 1 absent.
Motion carries. Mr. Akers.
Mr. Chairman, I offer a resolution authorizing real property tax law corrections of errors. I move this resolution.
Seconded by Ms. Kern. And any discussion? No discussion? All in favor?
Aye.
Opposed? Carried. And next, Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2020 budget for the Treasurer's Office for additional sales tax distribution. I move this resolution.
Is there, Mr. Denisha seconds it? Any discussion? No discussion? We have a roll call vote, please?
Reagan,
Yes.
Forsythe,
Yeah.
Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piacco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
14 yes, 1 absent.
Motion carries. Mr. Akers.
Mr. Chairman, I offer a resolution modifying the 2020 budget for social services for foster care, safety net, and heat. I move this resolution.
Is there a second? Mr. Perkins. Any discussion? No discussion? Okay, we'll have a roll call vote on this one as well, Kelly.
Forsythe, Lightfoot,
Yes.
Sheridan,
Yes.
Smithers,
Yes.
Denisha,
Yes.
Perkins,
Yes.
Akers,
Yes.
Fay,
Yes.
Haggard,
Yes.
Piacco,
Yes.
Burke,
Yes.
Arquette,
Yes.
Terminelli,
Yes.
Curran,
Yes.
Reagan, 14 yes, 1 absent.
Motion carries. Mr. Akers?
Mr. Chairman, I would defer to.
Yes.
I would defer to Mr. Burke as this is his resolution.
Go ahead, Mr. Burke.
Mr. Chairman, I offer a resolution calling upon the state of New York to provide relief to individual investors of rental property impacted by reduced rent collections due to the COVID-19 pandemic, eviction restrictions, and the eviction moratorium. And I offer this resolution for approval.
And Ms. Kern seconds it. And anyone else seconds? Okay. Any discussion? Mr. Akers?
Mr. Chairman, I'll be not voting for this, and it's surely a semantic thing where I believe that it's discrimination against corporations. We have many small corporations that actually have rental properties here in St. Lawrence County. Part of the reasons for corporations is for protecting themselves from liability and just efficiency of operations. And I think while I think it's great that Mr. Burke has put in this resolution to protect those landlords, it leaves out those family corporations, and I'll be voting against it.
Okay. Mr. Fay?
I'm going to abstain.
Mr. Fay abstains. So noted. Any other discussion? All in favor?
Aye.
Opposed?
Opposed.
Mr. Akers opposes. Motion carries. Mr. Akers?
Mr. Chairman, I offer a resolution establishing a standard workday for New York State Retirement System reporting purposes. I move this resolution.
Seconded by Mr. Smithers. Any discussion? No discussion? Okay, we'll have a all in favor?
Aye.
Opposed? Carried. Mr. Denisha?
Mr. Chairman, I offer a resolution authorizing filling of vacancies and move its adoption.
Is there a second? Rita Kern seconds. Mr. Smithers seconds. Any discussion? All in favor?
Aye.
Opposed? Carried. And Mr. Smithers, would you introduce my resolution?
Certainly. I offer a resolution urging the state of New York to promptly disperse previously awarded statewide interoperable communications targeted grant funding to St. Lawrence County and move its adoption.
Seconded by Mr. Akers and Mr. Lightfoot and Mr. Denisha and Mr. Tony Arkwood, Rita Kern. Am I missing anyone? I think I got them all. Okay, any discussion? Go ahead, Tony.
Thank you, Mr. Chairman. I received word from the governor's office just before the meeting that the Department of Budget will be moving forward with this $6 million allocation. I believe, Mr. Chairman, that they tried to reach out to you as well with proper protocol, but I think that you'll find that that's there. So I just wanted to make everybody aware that that appears to be something that's on its way. Thank you.
Okay. Any further discussion, Mr. Burke?
I wonder, based on what Tony just said, is the resolution needed at this point? Or I don't know. I guess I'm just asking the question. We all certainly want the money, but I guess I just wonder where we would stand with this.
Mr. Burke, the answer to that is it was requested by several legislators that they wanted to vote on it by way of motion as well as signing the letter. That's why it's on the agenda.
Mm-hmm.
And Mr. Arkwood?
Thank you, Mr. Chairman. When I had my hand raised originally to be, you added me as a sponsor. I'd like to be removed. I was raising my hand for discussion purposes. Thank you.
Okay. So noted.
Thank you.
Any more discussion? Mr. Denisha.
Thank you, Mr. Chairman. I certainly in favor of this resolution, and I had actually signed on prior to the resolution. But I guess I'm wondering the same thing that Mr. Burke requested brought up. If indeed the funding has been approved and is coming our way, is there a need to carry through with this resolution? Because the intent of the resolution was to get the state to act to get the money to us. If the money's coming,
I wasn't aware it was approved when we put it through. When was that approved again, Tony?
I got the call just prior to the meeting, and again, it was phrased to me that the governor's office reached out to you to make you aware of this, but wasn't able to make contact. And I believe with the administrator as well.
Yes, and I did speak with our regional rep.
Okay, okay. Well, it's Mr. Akers.
Well, we don't have the check yet. We have a verbal that the check is here. I suppose that we could. The problem is that this grant was awarded in 2018, so we're talking almost 3 years ago. And the fact that we had to come to take this action to help stimulate this is pretty sad. So I don't want to make this political, but this is what it is. It's been approved, and we were supposed to receive this money in 2018, and we're just getting it now. It seems mute. I'm not sure. I'd rather see that the check is in the mail, that we actually have it. And so I really don't see any problem with approving this resolution.
Okay. Any more discussion? Go ahead, Mr. Denisha.
yeah, I'd like to offer that we table this resolution until the next full board meeting.
Second.
I'll second that.
Okay. Seconded by Mr. Akers and Mr. Artwood and Ms. Haggard and Mr. Smithers and Mr. Perkins and Ms. Frida Kern and Dan Fay. Okay, so we're going to table it. All in favor of the tabling?
Aye.
Okay, any objections? No discussion on that, I guess. Okay, that means now we've voted to table it, so there's nothing more to chat about on that resolution. All in favor of tabling it? Did I take that vote?
You did.
Yeah, you did.
All in favor? Okay, good. It's carried. We're going to table it. Next thing, Ms. Kern.
I apologize for this being late. Do I need to ask for a suspension of the rules to add this?
They're already suspended.
No, this suspension of the rules has already been approved at the beginning of the agenda.
Yep.
All right. Thank you, Ruth. So I am offering a resolution, Mr. Chairman, recognizing January as Human Trafficking Awareness Month. My data came late, so we're kind of doing it after January. But I'm moving this resolution.
And who seconds the resolution? Mr. Perkins. Any discussion? No discussion? All in favor?
Aye.
Opposed? Carried.
Thank you, everyone.
Okay, now we'll move on to the county administrator's report.
Yes. Happy to be back with you this evening. And I wanted to thank you for delaying the review of the quarterly report to this evening, which I'll get to in a few moments. Wanted just to give you a COVID-19 update from county government standpoint. I'll be looking to extend the state of emergency by 30 days. It's scheduled to expire next Monday, February the 8th. So the extension would be from February 9th through March the 10th. What that would provide for county government is an extension of the 50% staffing levels that we have been in place with since November. As you heard this evening from Dr. McGuire and Dr. Williams, our vaccinations are underway for our 1B, and the partnerships with hospitals and our colleges has been invaluable to us, with staff and volunteer assistance being critical. So a number of county staff, as well as the public, as well as providers, have all volunteered their time. Even one of our legislators participated in making sure that vaccines are provided when we receive doses. We'll make sure to get those out into the folks that are eligible. I think, also want to follow up on Dr. Williams. We did hear last Friday that the health system has now received their Rheonics machine, and their goal by the end of this week is to have all of their PCR testing in-house. So I think that will accelerate the response time for results. Rheonics at Claxton Hepburn, I believe the term they're using was ratified. They're getting trained on it, and they hope to have that in service this week as well. Part of the on-pause outcomes is that St. Lawrence County, along with the other counties in New York State, must prepare a pandemic plan. And that is, I think, to help us should we find ourselves in a situation in the future, but also to categorize what we've learned from the processes that we've undertaken since last March. So that process is coming to the draft stage, which needs to be shared with the unions. I'll be communicating with the unions. The law does not speak to a date, but the goal is early February. So we'll be looking to share a draft with our unions of the pandemic plan, individually by departments. It'll be categorized, and I'll share that also with the Board of Legislators. It is to be submitted to the state by April 1st. So that's underway, and we'll share that with you as soon as it's prepared. I did want to share with you a couple of recommendations, as well as point out a couple of things associated with our quarterly report from the fourth quarter of 2020. 17 departments, if you took a look at your summary, came in over budget, and 8 departments came in under. But what I would reflect on is 2019, where we saw and understand the results already at this point. 16 departments at that time were coming in over budget, only 9 under. The average percentage right now we're looking at is 11%. Last year at this time, we were looking at 25%. And that brings me to one of the recommendations before I point out some specifics. What I was hoping to do after providing you with this quarterly report for probably about 5 years now is look at requesting from the board the ability to provide you with the fourth quarter in February. If you recall, when we come back in January, many of the bills for December aren't yet either received and or paid and cleared our system. So I think considering the holiday in both months, that also delays some of the payments and audits that we provide so that we can reconcile our payments. If it's possible and the board doesn't object, I'd like to move the fourth quarter report for 2021, which would be next January, into February, so I can give you a more accurate picture of what that looks like. So you have the report, and even just in 1 week's time, the changes, because we also collect that a week ahead, have changed 4.1 million increase in revenue and 1.3 million increase in appropriations. So that's quite a swing from what you saw when you received your packet for January finance. And while I think it's important to get information to you as quickly as we can, also as accurate as we can in real time makes more sense. So if there's no objection, that's what we'll plan for the close of this year in 2022. Just a couple of areas I know that are of interest to the board. With regard to health insurance, that came in much higher this year than budgeted. However, that was also taken into account for 2021. So we budgeted 13.5. And if you recall, we've separated out pharmacy, admin, as well as from our health insurance cost. That came in at 15.9. So that's an increase of approximately 2.4 million. This year, looking at how that was trending toward the end of the third quarter, we've increased that budget to 15.5 for this year. So I think we've accounted for some flex in that number. You'll also recall that we've settled contracts for 3 unions in 2020, and those in 2021 will start to see an increase in those percentages from our membership. With pharmacy, we budgeted 6.653 million, and then we came in at 7.3. So an increase of almost 700,000 over what we budgeted. Again, taking into account the budget for 2021, we budgeted 7.2. So I think we've made some adjustments looking at where our projections were coming in the later part of the budget process to account for that in the budget that you're going to be looking at this year. In Medicare reimbursements, we budgeted $875,000. We came in at $1.045 million. So that's an increase of approximately $170,000. Again, same premise applied. For 2021, we budgeted $1.1 million. So in each of these areas, there have been increases looking at where our actuals were coming in, not accounting for the increases from percentages, because we'll see those as the year progresses. We're looking at an increase overall in those three areas. Now, there are others, they're much smaller, of about 3.2. COVID-related, which we'll be seeking FEMA reimbursement for, is approximately $318,000. We're cleaning up the overtime that many of you are aware of between buildings and grounds, coming in and doing additional cleaning, and a number of things in public health have required overtime this year, but we'll be seeking reimbursement against those expenses. Overall, in the CARES Act funds that has already come in, and the board's recognized in resolutions, while they've also recognized the new appropriations, that's approximately 1.2. That's revenue we already expect. Now, in contrast with FEMA funds, we'll be seeking that, and I imagine there'll be a process involved that will be back and forth demonstrating what those expenses were for. Moving over to the revenue side, you're certainly all aware of the sales tax improvement over budget of 59.082. We came in at 63.5. So that's an increase of 4.5 million. 2021, we've hedged just ahead of the last couple of years and budgeted 60.4. So we're not fully expecting what we saw this year or even last, but our number, I think, is a little bit more in line with what we expect to see, should we see any decreases. Occupancy tax, we talked to you about the reduction with the shutdown. We came in about 69,000 short so far, budgeting 464,000, coming in right now at about 394,000. Now, with these revenues, this one and tribal funds, we've left the revenue the same. So the understanding for this year coming, tribal funds is another good example. 2.45 was budgeted, and we've received nothing. We've left that flat for this year, but remember, the first quarter of the year is the fourth quarter of the state's year. So that wasn't COVID related. And our treasurer has been very interested and communicative with the state to find out if there's any information that can be provided on when those payments could be expected. There hasn't been any information shared yet. With regard to the high water funds that you've become familiar with and accustomed to, we have not increased the budget annually, but for the last 3 years experienced approximately 300,000. Now, you know we share out the amount additional that we receive, similar to the tribal compact funds. And we've improved upon that budget this year just modestly from 655 to 855. So we're looking at a slight increase there. In Department of Motor Vehicles, as you know, the shutdown certainly impacted revenue there, but they've recovered tremendously, looking at only about 160,000 right now in the downstate category for what they're missing compared to budget. Now, overall, when you look at all of the satellite offices that we have around the county, the reduction in overall revenue in that area is around 830,000. So that shutdown period, which now is open by appointment, will provide us an opportunity to recapture some of that over the last year. And left for this year, the revenue flat, with the expectation that the downstate business continues. Are there any other questions related to the quarterly report that you took a look at, or concerns with me pushing it to February for next year? Okay. Wanted to bring some good news to you. You may have seen a little coverage over. As we brought to you the Moody's rating, bond rating for the Canton Human Services Initiative, we've now just completed the Standard & Poor's global rating, which was rated, I believe, in 2017 at an A, has been upgraded to an A+ with an outlook of stable. And I'll read you just a couple of comments in the overview that were provided to us. The upgrade reflects the opinion of the county's improved budgetary performance, which has boosted reserves over the past 3 fiscal years. We reviewed the county's fund balance policy, adopted in 2016 and adhered to since, as an important tool to safeguard the county's budgetary improvements. also discussing how well the county's budget has held up, certainly assisted with sales tax revenue during the pandemic. It says, thanks to conservative and prudent budget practices, management has also been able to steadily increase reserves, which we believe will provide an important buffer to absorb any unanticipated declines in reserves or unexpected stagnation in the country's economy. That said, there are lingering risks, but overall, the county has very low debt burden, and its pension and other post-employment benefits are manageable, which in their opinion supports the rating. So we're very proud as this covers overall our general obligation debt. And just as a reminder, we have the outstanding debt on the jail. We have a highway bond for equipment that will be paid off in '26. We have energy performance contract bond sitting out there at this time. Any questions? Okay, just by way of update then.
Yes, Ms. Haggard's got a question.
I'm sorry, Ruth. I wanted to go back to something you said before. Go ahead, and at the end, I'll ask my question if that's okay.
Sure. Just a couple of other items. The November bank reconciliation is complete and available to you on Google Drive. Tomorrow, the Vacancy Review Committee will meet at noon, and there are 24 positions to be reviewed. And next week at Operations, Barton and Lojudas will join us to present on their assistance they'll be providing on the 5-year update to the hazard mitigation plan. And that's all I have unless there's questions. I believe Ms. Haggard.
Any questions of Ruth? Go ahead now, Ms. Haggard.
Thank you, Mr. Chairman. Ruth, I wanted to go back and talk a little bit just about the 50%. When we declare the state of emergency again, we would be able to follow that. My understanding of that was that that is to reduce the exposure that people would face. So if somebody's coming in every day that's really not helping the system. In addition to that, I'm wondering when the people who have more of a hands-on job and can't work from home at the 50%, they are working in the call center. Is that correct?
So the 50% is being carried across departments that are not, by the state standard, considered essential. However, that's not a term that I like to use. I believe that everyone on staff here is essential. But I believe that the interest at the call center is to have departments, either if folks can't necessarily fulfill the obligations they have to their job, when they would be home, they can work in the call center, but also making those assignments so that the call center staffed 5 days a week. And that has been a challenge for us. Does that answer your question?
Well, that was going to be my follow-up question. Is the call center staffed properly, or what seems to be the issue there?
Well, I think probably about 3 weeks ago, we did have an exposure associated with the call center. So I think that gets everyone a little bit more on edge. I think we have tried to limit the folks in that area, but there are still some folks who are concerned. It is a challenge. We have looked at the opportunity to do the call center in a remote fashion, but that doesn't really work when you get questions that you can't answer if you're from another department. Public Health has been extraordinary about having one of their staff members in the call center to be able to answer questions. You may recall that. But it's a challenge for us. We've got a number of folks now, much like other organizations, where we have folks in quarantine or we have folks that are out because of a positive diagnosis, and that prevents them from being available to us. What we do have the ability in their normal duties is if they're feeling okay and they're in quarantine, they still have the ability to do some of their work functions.
And it's my assumption that we're on 50% in order to cut down the contagiousness in like the spread of the disease. And I think, go ahead, Ruth.
That's okay. The exposure component, I think some of the things that we're reading about now and looking at is the cohort scheduling. For example, highways using that model so that you actually have almost two entirely different sets of folks so that if one group was quarantined, you still have an entire group that could function independently of the other. and still get the work done. And that actually, I think, is what we're starting to see a little bit more supported, is having those folks who actually don't necessarily work together every other day, but may actually work together as a group, and then the other group comes in while they work at home. So those are some of the things, and that's another thing I wanted to mention also, is with the modifications we made in August, which if you recall, was when we returned some of the folks to the offices. We put plexiglass up, we have the arrows like we do in this room, lots of signage about 6-foot distancing, things of that nature. So over the next couple of weeks and month, we're going to be auditing that function to make sure what we've put into place actually works. We certainly still aren't seeing the public at the levels that we once were, but for employees' use in and around the buildings as well as in their department, I think important to look at that process and make adjustments if what we thought would work actually doesn't fit the need.
Thank you very much.
Any other questions?
Yes, Mr. Akers.
Thank you, Mr. Chairman. Ruth, is our drive-through open at the DMV here in Canton now?
It is not yet.
And can you tell us why?
I believe preparations are underway to make that happen. Signage is being made. The concern is the nature of who may turn up. I think when probably 2 months in, you'll recall I shared a story with you of a long queue over 2 hours at one of the drive-throughs that attempted to open back up. So they're trying to make sure they put the right protocols in place. But their hope is to open very soon.
The Reonics machine, Claxton's had that for a couple of weeks now.
I believe that's true. I'd have to go back and look at the date, but yes, and they were.
You mentioned that they're undergoing training now.
I believe the training should be complete this week. I think they started the training on the 25th.
Is there much setup to the machine?
I could not answer that, but I could find out.
Well, it seems if they've had it for 2 weeks, it seems like they could have been proactive and actually had the training done, working with St. Lawrence Health System to see that what to do, what the functions were, how to operate it. So I look at it as this $50,000 investment. We've lost 2 weeks. We were supposed to have the machine at the end of December. We're just getting the second one down. Is that correct?
The second one was delivered Friday.
Okay. Yep. So I'm deeply disappointed about it. One of the comments, Mrs. Wilson there tonight talked about the snowmobile monies. Where is that? Can you give the legislative body any sense of what's happening here?
With regard to that particular group, so as you're familiar, and I certainly can speak to this more once I post some information together for you, that group is one of those that's received funding. Currently, the Soil and Water Conservation District prepares the grant application and turns the funds around to be provided to the Snowmobile Association. The Snowmobile Association then provides it to the local clubs. There is an option, as I understand, to be able to do it individually, but I believe many, many years ago, they consolidated and put one application in together. I'll have to look into the specifics associated with the equipment and things that were referenced this evening, but there are conversations that are ongoing, and I believe there's one scheduled for this week.
Okay, thank you.
You're welcome.
Tony, do you want to add anything to that?
Thank you, Mr. Chairman. Just to add to what Ruth said, we're scheduled for 4:30 tomorrow to have discussions in and around some of the concerns that were raised tonight in that regard.
Thank you, Tony. Mr. Burke?
Ruth, you mentioned the bonded debt that we have. This may be a dumb question, but can we prepay our bonded debt? And if we can, is there any advantage to doing such?
So I believe it was early in the budget process this last year. I believe perhaps it was Finance Chairman Akers asked about that question. We did reach back out to our bond counsel. I believe that we know that the call dates are not for at least a few more years. I think the earliest call date, which would mean a refinance option, is 2025. But if those and when those options are available and the market supports it, we'll bring that to you for consideration. I believe we have a few years yet before we can refinance any of those.
Thank you.
You bet.
Any further? Yes, Mr. Akers.
Well, earlier, Renee, Renee, could you tell us what we're paying for interest on those bonds?
Hi, I can get you the information. I don't have it handy, and each of them are different. And some of them are an aggregate rate, interest is a certain percent 1 year and a different amount another. I did turn this on. I don't know if I could speak for a second about the bond ratings. I meant to get in earlier, but it just was moving too quickly.
Yes, go ahead, Renee.
Okay, if it's okay. And it was just, I just wanted to share a remark we had from our contact at Fiscal Advisors. They help us make contact. They help us arrange when we are doing a borrowing. They put us on schedule, give us some interest rates for when we are borrowing and that type of a thing. But they also help us through this process when we are being rated by these agencies. And the comment I had from him when I spoke with him last week was that was the fastest back-to-back upgrade he can remember seeing in his history of doing it. So it was nice to hear. So that's all I wanted to add. Thank you.
Any further discussions? Okay, thank you, Ruth.
Yeah.
Any old business? Reed Kern, Legislator Kern, go ahead. Any old business?
Hi. So last week we voted not to extend the sales tax agreement 1 year, and we voted not to extend it for 2 years. But since the 2 years also failed, I wasn't sure, and it would have to be somebody from, I guess, the group that first introduced the resolution to extend it just 1 year. I was not sure if anyone had any interest in reintroducing any of that, as I'm sure some of us would still have interest in trying to extend the sales tax agreement by 1 year.
I believe those discussions are usually held in executive session.
Oh.
About what strategy would be.
Sorry.
But anyone's free to correct me if I'm wrong. Go ahead, Jim. Go ahead, Mr. Lightfoot.
Well, I don't hear any hue and cry out there to do what Legislator Kern is suggesting. So I think that perhaps silence gives you what the answer is.
Any other old business?
Ms. Haggard.
Ms. Haggard? Oh, go ahead, Ms. Haggard.
I believe I was the person that offered an amendment to 1 year, and I'd be happy to discuss that in executive session.
Okay. I'd be happy to hear you. Okay. Any new business? No new business? Okay, let's go on to committee reports. Are there any committee reports? No committee reports. Okay. Then let's go into executive session. We have a motion to go into executive session. And for what reason, Ruth, would we go in?
Litigation, negotiations, consideration of 12 appointments and personnel for the use of time.
Okay, thank you. Mr. Smithers? Okay, so we've made the motion. Anyone second it? Mr. Perkins?
Yes.
All in favor?
Aye.
Opposed? Let's go into executive session.
And Bill, I just have a couple things before you adjourn. I wanted to.
Okay, I'm going to read the
appointments as well? Okay,
chair.
and maybe just before we adjourn, I just have a couple more items to mention.
go ahead.
Okay, thanks.
Okay, for appointments, Ms. Kern, operations, do you have any appointments?
Yes.
Go ahead with the appointments, Ms. Kern.
For St. Lawrence County Fair Housing Task Force, Connie Jenkins, Amy Plumidor, and Chris Nyman. A reappointment to the Environmental Management Council, Joseph Brandt. Fire Advisory Board, Eric Johnson, Scott McRobbie, Richard Russa, Stephen Parker, Larry Whitten. St. Lawrence County Planning Board, Kim Bisnet.
Thank you. Any problems with those names? Anyone? Okay, let's go on to Mr. Akers, the finance.
Mr. Chairman, I offer for the St. Lawrence County Industrial Development Association, Stephen Morrill of DeKalb, and for the St. Lawrence County Soil and Water, I offer Robert Andrews of Dublin.
Any questions or any concerns? Okay. Ruth, you have some issues you'd like to?
We just need a motion, a second on those. You can do them as a whole for the appointments and a vote.
Okay, let's, a motion to accept those appointments made by Mr. Perkins, seconded by Mr. Lightfoot. Any discussion? All in favor?
Aye.
Opposed? Carried.
Want me to go ahead? A couple of items I neglected to mention in my report. Transfer of funds, which I'm required to report out to the board. There are 3 this evening. One is for the treasurer's office for postage expenses for delinquent tax notices in the amount of $150. The second one is for the county attorney's office associated with professional liability insurance increases of $4,415. And the third is for the self-insurance program. The annual bank fee to Triad has increased in the amount, an additional need of $1,755. So those are the transfers at this time. And then the last item I just wanted to mention was a request we've received for a letter of support. If you recall, I believe it was just over a year and a half ago, there was conversations about a program, I believe with Clarkson, at the Messina transfer station related to gasification. And the New York State DEC was supporting some endeavors to try and explore this technology. They have renewed that effort and have requested a letter of support. And if there's not a concern with that, we'll have Chair Sheridan sign that tonight so that we can share that with the U.S. Department of Energy. Okay, that's all I've got.
Okay, thank you. Mr. Akers.
If there's nothing more, I would move that we adjourn.
No, I've got the chair's appointments. I'm going to let you know it'll be short on the chair's appointments because I'm just going to let you know that the additional people that were not on the committees before, the new people on the committees that we've all been used to being on for the last year. Susan Fiacco will be on the Fiscal Stability Budget Review Committee. Susan Fiacco as well will be on the Board of Trustees for Supreme Court Library.
Suzanne.
Buildings and Grounds, Kevin Akers is the chair. Consolidation, Margaret Haggard will join that committee. Solid Waste Highway is Harry Smithers, the new chair. Susan Fiacco is added on to that committee as well. Highway Solid Waste Committee. Labor Management Committee, Harry Smithers is added onto that committee. Legislative Liaison Committee is Kevin Akers and Joe Lightfoot. Recreation Trails Advisory Board, Rick Perkins. And one more, I think. Youth Advisory Board, Nicole Terminelli, Bill Sheridan ex officio. And Nicole, if you could call me right after the meeting on my cell, I'd appreciate it. I want to talk to you about some other appointment that we don't have to talk about here. Other than that, motion for the...
Mr. Chairman.
Yes, go ahead, Mr. Denison.
We've got a question on the Buildings and Grounds Committee. You said that Mr. Akers was chair of the Buildings and Grounds Committee?
Yeah. That's what I've got here, although...
It's news to me.
Yeah, I think Larry took over.
Yeah.
Yeah.
Okay. I couldn't remember putting that down. I think that was a mistake when I think about it.
I was already calling for an excavator.
What's that?
I was already calling for the excavator.
You never have it on there, right?
I have not, no.
Somehow I got that name off an old list or something, and that's a mistake then. So, you are.
I'll gladly give it up.
No. We're gonna keep you where you are. Larry.
Sorry.
I got you on that committee, but I didn't have you as chair. Maybe someone, Kevin, have you been on the committee?
No.
I'm not on that committee.
Never been on it, okay, we'll cross that off, my air, or someone's. Okay, don't worry about it. Okay.
Cancel the excavator.
So
Yes. What, one more thing? Tony?
Move to adjourn. Move to adjourn.
Okay.
Second.
Second by Mr. Akers, adjourn.